on when you begin speaking and off when you've completed your remarks. For all presenters, please state your name for the record before speaking or responding for questions. Our first briefing this morning is a Medicaid Behavioral Health Services budget note briefing. This was brought forward by myself and Commissioner Moyer. And I would like to invite our guests up to the dais. This is centered around Medicaid behavioral health services. And we have many partners here today. It's important we collaborate to serve our shared clients, particularly as all of our organizations are facing fiscal realities. So with that, I will turn it over to Commissioner Moyer for an introduction.
Hello, thank you so much for joining us today. One of the reasons that we brought this budget note forward is the level of complexity that Oregon has created in its Medicaid system, particularly in behavioral health, which I think has caused some challenges for local governments and providers and others to figure out how we navigate the different jurisdictions in order to hopefully try to piece together a more fluid and functional system for people who are experiencing behavioral health needs. In that conversation, I think a few things have come up that I'm hoping that we can discuss today. You know, I think there's a lot of questions about who does what and who's responsible for what. I think that there are concerns that the system as a whole has some, I want to say gaping holes. I also think the word system is a little bit of a stretch. But how do we work together? I think the overarching goal really is, you know, what are our distinctive realities, but also how do we work together in a shared interest in being able to help the people of Multnomah County have a system that helps them reach the best standard of life and maintain that as much as humanly possible. And when people do have crisis, how do we help restore them back into the community and support them to stay well? So I am really looking forward to this conversation and hope that this is the beginning of some collaborative work that I hope we can do as we vision through how to better deliver for Multnomah County and our potential shared advocacy to address some issues with the state. So thank you so much for being here. I really appreciate it.
All right, with that, I will turn it over to Rachel Banks, our director of our health department at the county. Good morning.
Good morning, thank you, Chair. Try it again. Good morning. Thank you, Chair, for being here. Thank you, Commissioner Moyer. Hello, Commissioner Singleton, Jones-Dixon, and Brim Edwards, wherever you are. For the record, my name is Rachel Banks again. I have the honor of being your health department director. I am here with my esteemed colleagues that you'll hear from in a minute, including Mindy Statlander, Chief Executive Officer of Health Share of Oregon, Dr. Amit Shah, Medical Director for Care Oregon, and Courtney Johnston, Senior Director of Government Affairs for Trillium Health Plan. So today we are going to try to shed some light, as you asked for, Commissioner, on the complexities of the system, talking about roles and responsibilities, who does what, and then take a deeper dive into the behavioral health system. We can go to the next slide. As well as talking about how we currently work, the things that we work on, as well as some opportunities for partnership moving forward, some of the opportunities, but also challenges that we have in front of us with HR 1 and a variety of other things. We will mostly be talking about the behavioral health system today, but we'll touch on some of the other partnerships in the public health space with our community improvement planning and some of those things as well. So if we go to the next slide, the next couple of slides will be talking about roles and responsibilities. And what I'm going to do is start with our roles here, county specific, in the local mental health authority, as well as the community mental health program, then zoom out a bit and talk about the state roles, as well as CCO roles. So if we go to the next slide. So these next couple of slides are really talking about the statutory basis for our role and how that comes to be. So clearly our role is defined in Oregon state law. The Board of County Commissioners, so you all are the local mental health authority, and that includes behavioral health policy. Obviously, it includes the funding that you all graciously provide for our behavioral health system in terms of county general funds. It includes the adoption of the CLP, the Comprehensive Local Plan, that we've had many conversations about over the past many months, and was just adopted in January. And then we at the department are the Community Mental Health Program, so the CMHP. And the CMHP is responsible for delivering a variety of services, providing for the uninsured, underinsured, safety net. I'll talk more about that in the next slide. We both have a statutory relationship and a contractual relationship with the Oregon Health Authority through what we call the CFA, so the County Financial Assistance Agreement. And we've been having conversations about some of the changes in that, and you'll hear much more about it when we come back next month for our budget presentation. So more on the CFA to come, but just wanted to note that we do have that relationship with Oregon Health Authority as well. And if we go to the next slide, these are some of the statutory service obligations that we have, and the services that we get to provide here as the Community Mental Health Program. So as I mentioned, we provide services for the uninsured, underinsured safety net. So anybody in the county has access to services. So we both provide broad-based services for anyone, as well as specific services for folks in need. We do that through a variety of different programs, including addictions and prevention, including care coordination, commitment and diversion, direct clinical services that we'll talk a little bit more about, as well as our safety net. And then, not to be underscored, the administration and quality management of it all. I, at one point, asked some folks on my team about how do we do in services, and they talked about the 275 distinct data points and measures that we track and report to the state of Oregon. So I want to make sure that comes to light. And I should just give a shout out to all of the phenomenal people, some of them which are in the room today, but all of the workforce in the behavioral health division and the health department who do this work each and every day with a keen eye towards the mission and despite all of the various challenges. So we serve the most vulnerable, obviously, regardless of their insurance status. And the next number of slides will talk about our partnerships that are, some come in the comprehensive plan, but as well as other things. So if we move to the next slide, I'm gonna zoom out a bit here and talk about our system. I would say, to your point, Commissioner Moyer, that the system-based piece, that's really where we see a lot of opportunities for connecting the dots so that the people that we serve are not having to connect, and takes some specific strategies and supports, which I'd love to talk with you all more in our budget and some other things when we get there. I know I'm doing a little bit of foreshadowing because excited to have all these conversations. But what you see here, obviously, is we're part of a larger system that starts with the Oregon Health Authority, which is responsible for setting the vision, the policy, and the legislative framework. They are responsible for Medicaid and funding and some of the rules and regs around that, obviously the CFA, and then the compliance, licensing, and certification. So if we go to the next slide, this is just another visual of how we work together. And, we talked about perhaps a story of what this looks like from a client's perspective as they're navigating multiple different systems. So, an example is for example, there's a Medicaid eligible adult that's enrolled in CCOs that we work with. They are, say, transitioning from a structured licensed residential into a sort of community treatment, and a situation and support in the community, and we all play different roles. So, for example, the state of Oregon has set up the licensing, the rules, regulations, and some of that, as well as the funding. Our role at the county is to specialize in working with them, whether it's in care coordination or in some of those services in the navigation of that, as well as providing the technical assistance to some of the providers in the background. Clearly, our CCOs have the responsibility for utilization, management, payment, and treatment services in coordination with various Medicaid benefits. So that's just a snapshot of kind of how we work together in that, and I will pass it over to Mindy.
Hey, good morning. And before you get started, and our guests do have a hard stop at 10 a.m. this morning, so we're going to get through their presentation, and then if we have time for questions at the end, we are. But I just really am grateful for everyone for taking the time to be here and to join us to have this important conversation this morning.
Okay, next slide. Actually, I'm going to do the CHIP next, is what I'm going to do, and then I'm going to hand it over to Mindy. So CHIP is what we call our Community Health Improvement Plan. It's a process that we work together on. If we go to the next slide. So what we talk about Healthy Columbia Willamette Collaborative, that is a community health needs assessment, which we call CHINA, which leads to the CHIP. Good morning, Commissioner. And so these are the group of folks who partner on that in this collaborative process, which has really been exciting. I've been a part of it for a number of years in the public health side, and as well as working health department wide. And so you can see here the collaborators. This is information that we use in our different plans, including the comprehensive local plan and some of our other plans. If we go to the next slide, we'll talk about the areas that have been prioritized, which I think are going to be no surprise to any of you all. But the top issues are safe and affordable housing, physical safety in community, affordable health care, trust in the healthcare system, and linguistically and culturally specific care. So the collaborative, which includes all of the partners here at this table and many others, work together on both this assessment as well as the implementation plan to address these issues. All right. Now I'm going to pass it to Mindy.
Thanks, Rachel. Good morning. Thanks, commissioners, for having us. My name is Mindy Statlander, for the record. I serve as the Chief Executive Officer for Health Share of Oregon. If you could go to the next slide. I'm also here with Dr. Amit Shah, who is the Chief Medical Officer of Care Oregon. I'll talk about our roles for a minute, but he and I are going to split this section. And we both have the honor of being previous Multnomah County employees, so we're super happy to be back here in this space with you all. So HealthShare is one of the two CCOs, Trillium Community Health Plan being the other that you'll hear from in just a minute, that serves Medicaid members in the Tri-County area. We are the state's largest coordinated care organization. We serve about 460,000 members. HealthShare is a local 501c3 nonprofit that was founded by you all in part, the other two counties in our service area, and local hospitals and health systems to figure out how to best serve the population in the Tri-County area. So you can see the list of founding member organizations. Those organizations still continue to be on our board. Care Oregon is a key partner in that, and as part of the conversation today, they provide the operational backbone and support for much of the behavioral health benefits. We work sort of hand in glove across our two organizations to deliver that benefit. If you go to the next slide. And just wanted to point out before we go a little bit further in the weeds on behavioral health that Multnomah County is a founding member of HealthShare, has a permanent seat on HealthShare's board. You and Director Banks, you have a fantastic representative and advocate for the work that you all do. And also the deep amount of work that transcends behavioral health that our organizations do together. Fundamentally, we think, as we take care of the Medicaid population, which is a pretty prescriptive, though large and we want to pay attention to that. We try to be mindful of our role in the larger safety net system. So for folks that are uninsured, the clinics and providers that serve the Medicaid population are the same ones that serve folks who are uninsured. And really, we try to take the view of looking at the whole safety net. So you can see ways in which we collaborate. We'll talk about behavioral health, but things like the Healthy Columbia Willamette Collaborative, the early childhood system of care, how we do health-related social needs, all those are things for another day, but we have lots of intersecting places with our two organizations. So if you can go to the next slide. And then one more. So to talk a little bit more about behavioral health, this is just another view of the different roles and responsibilities that Director Banks shared. You can see in the starred areas, those are places that CCOs manage the risk for, so that means we pay for the services, and we're also responsible for contracting with the providers to deliver those services. The things that are not starred are either things that you all do or things that the Oregon Health Authority is responsible for. So this is the mental health system, and you can see that there is quite a bit of patchwork in that different responsibility within those different jurisdictions. We work really closely together with Multnomah County, also with Washington and Clackamas counties, to try to braid those systems as best we can, given our distinct roles that we play in the system, to make sure that as a member or a community member flows through and needs different services, that we're doing good handoffs, but I won't pretend that that is perfect or lands well every time, but we work really hard at it. On the other hand, if you can go to the next slide, the substance use disorder system, for Medicaid services, CCOs do have more responsibility for the continuum for that system. That is not to say that we do have that responsibility for folks who are uninsured, folks who are on Medicare, or who are commercially insured, so try to work with the other payers associated with that. Did you want to add anything? Okay, good. So I know part of this conversation was understanding the budget context, if you could go to the next slide, for what happened over the last handful of years. So I'm just sharing with you HealthShare's experience. So in 2020 and 2021, for part of 2022 in the early phases, we did see utilization in the behavioral health system decrease pretty significantly because of the impact of COVID. We know that providers were shutting down, people were staying safe in their homes when they could. We saw some depressed utilization. Between HealthShare and Care Oregon, also the legislature, we all made giant investments in the behavioral health system during that time period with the revenue that was not spent on delivering care to people during that time period. And then as we got into late 22, 23, 24, and 25, what we started to see was a pretty significant increase in utilization of services. And the amount that we were paying for services drastically exceeded the amount of revenue within the Medicaid system. If you go to the next slide, I'll let Dr. Shaw talk a little bit about some of the investments we made during that early time period when we were able to.
Yeah, thank you. And once again, commissioners, thank you for having me and all of us here today. For the record, I'm Amit Shah, Chief Medical Officer of Care Oregon. So as Mindy described, there was a lot of intentional investments from the pandemic gains, that 150 plus million that you may have heard that occurred between 2021 and 2024. And some of those examples that are really important is a really redesign of the model of care for the outpatient behavioral health services through strategic healthcare investments. Shift is what we called that. And really you could think of that as how did we replicate what we did with primary care in the history that we did with primary care and innovating it and doing the same with the behavioral health network, being able to advance and transform that network through significant investment so they're able to deliver the services they need to be able to do at the tune of about 18 million. Providing that low barrier, peer-led addiction treatment and crisis services provided by the counties, all the work that you do, and the $15 million investment. Really thinking about how to expand the withdrawal management programs in Unity and build out of intensive outpatient for children, youth, and adult services, interventional psychiatric services, and that behavioral health pharmacy services, which a lot of people don't even pay attention to, and really looking at some of the large numbers of almost $27 million invested in that. And then we know EPIC, the electronic health record system that is used pretty extensively throughout our communities and our providers, support for the behavioral health providers to have integration with that system and be able to have that information exchange that needs to happen, and having that happen at a tune of about $10 million. And then very importantly, as we look at our equity focus and our responsibilities around the populations, doing really culturally specific substance use disorder and mental health stabilization capacity expansion, expanding those services to with those providers that really provided that culturally specific service and finding a way to resource doing that.
So again, Mindy Statlander for the record, if you go to the next slide, As we get then into the time of 2024 and 2025, where the amount of spend of services drastically outpaced the amount of revenue, we had to make some hard choices about how to right-size the benefit. And I'll say this is really what CCOs are here for. In the initial vision of coordinated care organizations, you have providers and health insurers and community members sitting around a table saying, in good times, what do we do with excess or with Medicaid dollars that don't go to deliver services? Dr. Shaw just talked a little bit about the choices that we made in that time period. And at the same time, on the flip side of that, when we have more cost than we have revenue for, how do we make hard choices together about where to make cuts? And so just have a little graphic for you about the framework that our board, in partnership with our Community Advisory Council, developed to guide the set of choices that we were to make. So thinking about our stewardship of resources, focusing on our responsible and efficient management, equity, making sure that we were continuing to focus on promoting equitable processes and outcomes and not losing ground in the access to culturally specific provider services that we had made, and then keeping an eye on collective impact. So that's when I talked about that rainbow slide, being sure that we weren't inadvertently undermining our partners by cutting a part of the system that we were responsible for that inadvertently spilled out into other parts of the system. So none of those are great conversations to have. Those are all very hard choices. But that guided the work that we did over the last over the last 18 months or so. And the county was a key partner in having those conversations and weighing all of those choices. So at the end of the day, where we landed was focusing on making sure that we preserve high value access to the greatest extent possible. So if you could go to the next slide.
And then for the record, Amit Shah, Chief Medical Officer, Care Oregon. So, really what, as Mindy was describing, this has a lot to do with the collaborative and all the folks in partnership, especially Multnomah County as an example, around defining what does high value access really look like. And really, it's the right service at the right time with the right provider. If you have limited resources, obviously there's a need to prioritize to specialty behavioral health services, and priority access is usually reserved for the most at-risk populations, while still maintaining access across the clinical spectrum. Not an easy equation to do, but critically important. So some of the things that we talked about when we think about high value access is, really trying to consider both the individual member or patient or person in the community, as well as the community needs. Prioritizing the most vulnerable and those who experience the greatest health disparities. I mentioned earlier, our focus and priority around equity and making sure that we address disparities as required by CCOs to do. And for example, thinking about things like homelessness, severe mental illness, culturally specific populations, LGBTQ, children, youth, using clinical criteria, which is really critical. And populations are considered into 3 different tiers with priority access given to tier 1. Those at most risk for decompensation, suicide, overdose, relapse, and need for higher levels of care, children and youth. And you'll see this priority access having a lot of familiarity to a lot of what we did, and I think of the days when I was at Multnomah County, what public health does when you have resource constraints and how you choose to, tier or be able to think about how do you get access when you have limited resources and be able to do that. A very similar framework we took from Multnomah County's experience in public health that we applied to be able to do things around high value access.
So if you want to go to the next slide, Mindy Statlander for the record. So I mentioned this before, but as we thought about our budget priorities, we had those conversations with our board, and we agreed to make tough choices, prioritizing high value access, the core set of responsibilities that CCOs hold, keeping in mind the role of the safety net and services for members with high acuity needs. We also tried to create flexibility where we could in allowing our county partners to reallocate funding within the crisis and safety net contracts so that they could best plug holes where they saw fit, and have a continued joint behavioral health work group between us and Care Oregon and the counties that meet regularly to talk about how we continue to adjust and support each other in this work. If you can go to the next slide. I mentioned these before, so just a reminder of the different places where we have joint behavioral health investments, including in crisis services. We worked really hard to preserve and protect that very critical part of our safety net, and peer services and some other intensive integrated services between our two organizations. Where I think we have a lot of opportunity going forward, if you want to go to the next slide, I think many of you have heard me talk about this before, but HealthShare has been on a journey for the last 3 years to better understand the access needs, how we take better care of the population of folks who have an opioid use disorder, a stimulant use disorder, a psychosis diagnosis, or an unintentional substance-related overdose. We know that we have a lack of capacity within the system to really help support those folks whose acuity has gotten worse over the last 4 years. That is about both what we do at the CCO level, how we build a provider network to support that population, but also how we partner with you and our other county partners to ensure that the capacity within the mental health system, the substance use system, and the safety net system shows up in a way that's integrated to support that population. And then the other piece on the bottom is about the housing system and how we work across behavioral health and housing to be able to create an integrated system for those folks. If you move to the next slide.
For the record, Amit Shah, Care Oregon. So, when we talk about the high acuity behavioral health cohort, this group of people that Mindy was describing, you could see that opioid use, stimulant use, and psychosis, in the various circles that are there, there's a significant overlap of those groups, right? So really, as an example, 15% of all HealthShare members in the high-risk cohort had diagnoses of both opioid use disorder and stimulant use disorder in 2024. This cohort, you got to take a deep breath when you see this, drives 24% of the total healthcare costs. I like to say 25%. So 25% of the healthcare costs are driven by this cohort. And it makes up about 40% of the adult medical inpatient admissions. And you could see the numbers in there that when you really look at the numbers, it's large in these individual groups, but when you overlap them, you see it's a small number of individuals that are driving a large amount of the costs in the system. Next slide. So the analysis for the 3 regional strategies, really we wanted to focus on care coordination, clinical, and housing services, which includes, in care coordination, cross-sector case conferencing engagement with, these folks in this cohort to permanent supportive housing, post-acute discharge coordination when they are in acute services. How do we get them coordinated to the right services? We want to expand the clinical evidence-based clinical strategies to make sure everyone knows what is the best practice to be able to manage this population, and tailor the programs in housing programs. And then housing and services, really intensifying, referral pathways to behavioral health services, and really strategic planning, which is really critical to align the work between metro counties, specifically like Multnomah County, and HealthShare to make sure that work is really aligned to be able to get the housing services that are needed.
Next slide. Mindy Statlander for the record. And so Multnomah County has been a leader with us in figuring out how to integrate the housing system data that you all get from HMIS with healthcare data. And it's, I won't go through all of this, happy to answer questions about it or do a briefing individually if needed, but just to understand who we're serving together and what their needs are across both the housing system and in behavioral health is helping us both recognize needs in either end of the continuum that need to be filled. And so I'll just, we talked a little bit about the choices that we had to make to right-size the system. This population, I really believe if we keep pulling at the thread, working on process improvement together, understanding the needs of that population, that we're going to be able to better knit that rainbow together to make sure that it serves, it gets people the outcomes that they deserve. If you want to go to the next slide, I won't spend a ton of time talking about this. This is to say that we know that we still need capacity in the behavioral health system. The governor, back in about a year and a half ago, asked for a statewide report referred to as the PCG report now, on what kind of capacity we need in each of those kind of key facility types. So we've been working together with our county partners to track what have we funded, where do we still have gaps, so that we can make sure that we're pointing toward closing those gaps in the system. And then the next slide is just a summary of the different kinds of partnership that we have with public health. Dr. Shah referred to like using that harm reduction population health framework, learning a lot from public health. We make investments in the public health part of the health department every year to be able to continue that work together. So with that, I'll turn it over to Courtney.
Good morning, Courtney Johnston. For the record, I'm Government Relations and Communications Director for Trillium Community Health Plan. If you want to go to the next slides here, I'm going to try not to repeat too much what my colleagues up here have said, so let's go to the next one. I'll just do a brief introduction on who Trillium is. Trillium became a CCO in 2012. We started out of a local physician association in Lane County. We've been serving members in Lane County since that time. We became a part of the Centene company in 2017. Centene provides Medicaid services in 30 states. So we've got the opportunity to combine Trillium's deep community partnerships with this strength of a national healthcare organization that supports us in the services we provide. We are NCQA accredited. That means we have a kind of a built-in infrastructure for supporting quality outcomes. Let's go to the next slide. In 2020, we expanded into the Tri-County area, so we've been growing membership since then. We serve about 201,000 Medicaid members statewide and 39,000 here in Multnomah County. And then you can see we also serve D-SNP members in Medicare, and we have a commercial line of business. Next slide. So don't want to repeat too much what my colleagues have said here, but along the collaboration with Multnomah County, both in behavioral health and public health, I'll just add some of the work that, similar to what Mindy was just describing, as health and housing integration work group, and really supporting that continuum of care in the crisis continuum, supporting those wraparound services for our members. And then I won't list everything in public health, but in the delivery of the health-related social needs, we did provide some funding with community capacity building funding and partnered with Multnomah County in the delivery of those services in recent years. That's both housing and moving into nutrition. Next slide. A little bit about our priorities. We know that evidence supports treatment in the least restrictive settings, so we're working on promoting independence and long-term engagement. That means we're collaborating with our providers and our communities to expand evidence-based models that address behavioral health and housing needs. I should mention we are locally governed. We have a local governance here in our Tri-County region that is made up of community providers and community members and members of our CCO. We have a clinical advisory panel and a community advisory council that helps support the work we do. So with the support of those organizations, we've, as an example, recently in the last couple of years provided just under $2 million to Fora Health to expand recovery housing, build a 46-bed facility, and support assistance and housing and support services to really address what we saw as gaps in needs in those care. As we focus on prevention and early intervention, we work closely with the county on mental health promotion, substance use prevention, suicide prevention, the resource center, and all the crisis continuum services. We are looking and continuing to look for finding and closing gaps in that continuum of crisis services. I should mention here too that reentry is a new program that we will be supporting youth in carceral facilities and working closely with the county, and as that comes online in the coming months, I believe, to coordinate those services really closely. And then really looking at creating sustainable reimbursement for behavioral peer support across that continuum. We know how important these services are. We're not, to get to some of the points that have been brought up, we're not supported in our global budget to directly reimburse for those services as we might be for medical services. So we are looking at ways to, in team-based settings, to enhance value-based payments and enhance opportunities to support that provider type. Just the next slide. I think I'm turning it over here.
Did you want to introduce this? Okay. Hi, thanks, Mindy Statlander for the record. So Talking a little bit about what we're facing together and the opportunities in front of us, if you want to go to the next slide. We all have only a short amount of time as a state to be ready for the implementation of H.R. 1. We've already started to see parts of this bill being impacted. I want to talk about the two places in Medicaid that we're going to be really paying attention to is the implementation of work requirements and moving from what we have as continuous eligibility for people in the ACA expansion population right now, so they only have to renew every 2 years, to going to the opposite where they're going to be renewing every 6 months. So the continuity of coverage that we've gotten to provide for our community over the last 6 years or so is going to be significantly interrupted. I'll say as Oregonians, like, we're really good at managing this. During the public health unwinding, we had one of the highest rates of retention of Medicaid coverage in the entire country. And so we need to figure out how to pull out all those stops again, while recognizing that there are folks who will fall through the cracks as we move into this space. So the state has released estimates that this will impact we'll lose about 200,000 people off of Medicaid coverage over the course of implementation. About that, if you think about a third of the Medicaid population lives in the Tri-County area, that's about 70,000 or so community members that will be impacted by this. But given the outreach, that opportunity, the community presence that Multnomah County has, and the partnership you have with the two CCOs, I think there's lots of room to work together to make sure that people have access to information that they need about what's changing and what is not, and to point them in the direction of how to keep their coverage. If you go to the next slide. This is my working timeline of the major components of the implementation of H.R. 1, just so we can see them. This helps me think about what we have to do. So we have the work requirements beginning in January 1st of 2027. There's still some conversation about the redetermination timeline start. Our current waiver goes through the end of 2027. All the rest of the country has to start that biannual redetermination at the beginning of 2027, so we're waiting for CMS guidance on that. But just thinking about how we use this year, this is our last year, kind of to really get ready for that and do a good job in partnership, making sure we're sending information in the right ways, getting the right data to the right folks so that we can support members as they have to attest to these different requirements. If you want to go to the next slide. One more. Two more, actually. And so, do you want to take this one?
Sure. Okay. I don't know if you wanted to do the one before it, but okay. Courtney Johnson again with Trillium. So as we look to the future of how we can collaborate, I think we're really looking at opportunities for future investments with the county. We're looking at opportunities for piloting programs to increase healthy pregnancies and address substance use disorder in pregnant expecting parents, and I'd be remiss as government relations to not mention advocacy as we look at what's going on with H.R. 1 and what's coming, and how we as a community can collaborate to meet the needs of our members and information, education, navigation. But we also know that there are budget cuts associated with this that are pretty substantial. We're looking at, we just recently got out of a session that cut $210 million this biennium in the Quality Incentive Program. And then we are looking at about a $3.4 billion cut in federal funding in the coming biennium due to H.R. 1.
Next slide. Mindy Statlander for the record. Totally agree with Courtney. I also think opportunity around focusing on that high acuity behavioral health population and how we continue to build out a continuum for them and make sure that we are each allocating our dollars in the way that only uniquely we can, so that we preserve that continuum to the best degree as possible. I do think the shared legislative agenda is important, and then continuing the conversation about how the local mental health authority and you as a community mental health provider can play a role in ensuring that we continue to provide a continuum across all of our local needs. So, Director Banks.
Thank you. So with that, this is the wrapping up the end of content. We know that we have a hard stop at 10, but happy to answer questions here or following up. Definitely want to thank folks and hopefully gave you an idea of the system, opportunities, as well as the challenges and some areas where we can work together.
Yeah, thank you. So we'll open it up to the board for questions. Commissioner Moyer, do you have comments or questions?
Both. I want to ask if you very briefly explain what the state does, other than fund CCOs for Medicaid. What is the state role? Because I think that can get a little gray about things like the lines on inpatient, the lines on voluntary versus involuntary, people who are in the Oregon State Hospital. What is not your purview?
Hi, Mindy Statlander for the record. If you want to go back to the rainbow slide, or I guess Commissioner Moyer, thanks for the question. You can refer to the rainbow slide. You don't need to try to jump there. But among others, two primary responsibilities OHA has directly is to manage the Oregon State Hospital, all of that set of services, and the residential system. So if you look at the stars, those are things that CCOs do manage. If you look at the not stars, those are things that we are not responsible for, but work really hard to integrate with.
And I know that there are some changes coming that or are in effect that actually happened with our last renewal. Some have gone okay, some of them were, the state changed direction on. One of the questions I have around children's behavioral health is Oregon was told in our last 11-15 renewal that we were no longer exempt from EPSDT, which is early periodic screening, diagnosis, and treatment. I got that right. That was awesome. And yet, children have an incredibly difficult time here in Oregon, private insurance, Medicaid alike, this is universal, in accessing inpatient behavioral health. What is your role, our role, the state's role when it comes to children's behavioral health?
So Amit Shah, for the record. I think it's a great question, and it probably deserves, maybe even more time that we would have to be able to go into. But obviously, our priority is access, like we talked about, and high quality access. And we know that the children's system is even a bigger priority, and the services that are required as a CCO to provide, and how do we bridge that gap to make sure that those services happen. What you specifically describe around the EPSD services, there's been a long trajectory of history of how we've been able to connect with the communities to make sure that those respective kids can get the services they need, despite the fact that at times, those services are hard to get into. But doing that care coordination we describe and trying to make sure that that winds up happening. But I do think that the Children's Behavioral Health Network and system as a state and in our county deserves a much deeper conversation, because there are significant challenges in that area that all of us are working very hard to be able to ensure that we have that taken care of as we think, like you're describing, the next iteration.
And then I know we're so short on time, so I'm just going to leave this because I think this needs to be the first of, I don't need to be a board briefing, but I think that the commission needs to be more engaged in this work. I leave as like to think about how to answer in the future. What's not working? Your own data, which I cannot tell you how helpful it is to have had the overlap of our by names list and our homeless services with health share data to really paint a pretty clear picture that there is a behavioral health crisis that coexists with people experiencing homelessness, that 50% of people in shelters every night have a pre-existing diagnosis of a severe mental illness. We're not serving people well, or they wouldn't have gotten there. So I think there are two questions. How do we work better to prevent somebody from reaching that point? And then the second is people who are at that level of crisis. How do we use our homeless services system in partnership to help people regain the greatest degree of independence and support long-term success? So I'll leave it there. Thank you for being here. I appreciate it.
Okay, thank you. And we're right at time. Commissioner, did you want to have a quick comment?
Please. Thank you, Chair. I've got a billion questions, so I will send a follow-up email, and if we can get together and talk them through. Top one for me, I heard of HA, HB, HHI, and the Joint Behavioral Health Work Group. Are these all different? Are they coordinated? Who sits at which table? Is there something to fix there? And is our homeless response system in all of those conversations? That'll be my big one, is just some opportunity there to combine, and I'll get everything else out to y'all via email. Thank you.
Thank you, Commissioner. Commissioner Jones-Dixon, any?
No questions.
Okay. Commissioner Brim-Edwards?
Thanks for the presentation. I'm going to submit some questions. One that I would like to know is that on slide 27, it was, excuse me, a presentation of the gaps. And it looked like those were statewide gaps. Is that correct?
Thanks for the question, Mindy Statlander, for the record. This is Area Trauma Region 1. So this is Multnomah, Clackamas, Washington County, and then the north part of the coast. So just our region, not statewide.
Okay, and is it possible to get Multnomah County gaps, or is all the data collected from on a regional basis?
The way that the report was framed is really about those trauma regions, not about individual counties specifically. We can make some, oh, go ahead.
We do have, it's not exactly apples to apples, but we do have a cast analysis that was done just for Multnomah County, taking some statewide data and a national methodology, so we can get that as follow-up. It's not exactly the same thing, but it may help to answer some of your question, Commissioner.
Is that the OHSU gap analysis or something else?
No, that's one that we did a year before last with some investments from this county commission.
Great, I'd love to have that as well. And if there's, I can get a link to the regional report, that would be great.
Great.
Thank you.
Thank you so much. And we'll make sure that a lot of the materials that were referenced today get shared out with the board. I think that will be helpful as we dive deeper. And then I would encourage everyone on the board to not just submit questions, but set up some time to talk to these folks. I think we have really strong relationships with all of these partners, and have dug into really complicated and hard work together, especially as we're dealing with these budgets. And I just have appreciated the partnership so much of everyone here. And Rachel, thank you so much for sitting on the board and really representing Multnomah County well. So thank you all. Got you a couple minutes over 10 a.m., but we just really appreciate you being here today.
Thank you.
More conversation. Thank you. All right. So that concludes our board briefing today. For those folks who are viewing online, please do not disconnect from the meeting if you intend to stay tuned for our first budget work session for FY27. We are going to I'll go ahead and adjourn right now. And we will go ahead and shift gears into our very first budget work session. Emily, should I just roll in, or do you need a minute to make any switches? Ooh. Okay, we're going to take a 2-minute as we move the chairs down to the work session format, and then we will reconvene for our budget work session. Good morning, everyone, and welcome to the Multnomah County Board of Commissioners' first budget work session for FY27. Audience members, I want to start by asking you to please silence your electronic devices. For those presenting today, please turn your mic on when you begin speaking and off when you've completed your remarks. And for all presenters, please state your name for the record before speaking or responding to questions. And today's first budget work session is on the budget kickoff and overview. And with that, I will turn it over to Christian Elkin.
Thank you. Good morning, Chair and Board. For the record, I'm Christian Elkin, the County Budget Director. I use she, her pronouns. I'm really pleased to be sitting here today to kick off the fiscal year 2027 budget process. If we can go to the next slide, you'll see that our agenda covers the budget process, the calendar. We're going to have a high-level look at a lot of numbers, and we're going to focus on the general fund. We're going to focus on personnel costs and FTE, and then take a look at our one-time only funding. As with previous years, I'm just going to apologize in advance. This is a deeply data-driven and data-intensive work session. $3.9 billion. There's a lot of ways to slice that data. We've tried our best to do things that we think will be useful touch points for you during the budget process. And it also means that I have to stick to my script. If not, I'm really gonna mess something up. I just don't have it memorized as much as I want to. And then I also asked Jeff to poke me if I'm missing something that's important in the script and I've glossed over it. Also, I just want to set the tone that we will not be digging into any one department's presentation, but we will highlight pieces of if a department is driving a certain portion of maybe funding or revenues or those types of things. We'll want to highlight that for you so that you can kind of take that in and have that as you're thinking about when the departments come and present during their work sessions. They might be really focused on a specific aspect and you can say, oh yeah, I remember that this was kind of daylighted in that budget overview presentation. If you have any requests for information, we've already started giving you all supplemental information. We gave some to your chiefs of staff yesterday, but please just reach out to us and we'll be happy to get information. Please don't think you need to make your own spreadsheets. Not that I don't think you're capable of them. I'm sure you're, but you know we love spreadsheets, so happy to get you more information as it comes up and you have questions.
That's the next week's t-shirt.
Yeah. This budgeting is today. My last one was spreadsheets, so we'll just keep this. All right. Can we go to the next slide, please? So let's just take a minute and remind ourselves about the budget process and actually the amount of work that's actually gone in to get us to this place. Really want to recognize how much energy, effort, time, and dedication the departments have put in to get us to this stage in the budget process. So you can see kind of going from left to right, we start with preparing the budget. That typically needs to start with the general fund forecast because we need to know how much money we have to spend. That forecast was then updated in March. We try to update at every part in the process where you're having to make decisions. So for the chair, it was really important that she had the latest forecast. We want to make sure that if anything changes, we're incorporating that into the budget process and not afterwards or having to come back and readjust because that's really challenging for the organization. So in December, we released everything to the departments. From December through February, they were working very, very hard. We did push the process up a couple weeks this year to really try to accommodate the fact that the departments have to work through all of the winter holiday season and really wanted to make sure that there was enough time for them to be able to do that work and still be able to spend time with their families and do the things that are important to them outside of work. During that time, departments are meeting with the chair's office, they're meeting with the COO's office, they're meeting with their own internal department leadership teams and their equity teams and their community budget advisory committee. So they're getting a lot of feedback, how to prioritize, how to think about the work, and really that shows up then when they submit that budget in February. If you haven't had a chance to see some of the department transmittal letters, there's entire sections there where they talk about their budget approach, what their values are, what their primary goals are. We know when we have to make trade-offs, you want to understand what their decision-making framework is, and then they'll bring that to you in the department work session as well. So I think that's a really important piece. Then at the end of February through April, the chair's making her decisions, And then the budget office needs at least at a minimum 3 to 4 weeks to really compile it into all these documents and get everything balanced and ready to go. So last Thursday, the chair released her proposed budget. It's a really important step because you all can't have any public discussions of the budget until that budget is out, and I always say out into the wild or out into the ether. So that was a really important step. Then this Thursday, you'll approve the budget. And then following that, we'll just jump right into all the department work sessions. We'll have about 6 weeks. It's very intensive, as you can remember, a lot of information coming your way. So, and then hopefully we adopt on June 4th for implementation on July 1st. If we can go to the next slide, please. I won't run through all of these, but just as a reminder, this is what those 7 weeks look like. The topics that are coming, we heard a lot of feedback from you all this summer, so we did switch around kind of the order of operations. We're really gonna just jump right into the meat of the budget with public safety and health and human services. And so I hope that this kind of reflects what the feedback you all were giving us after last year's work session, or after last year's budget session. So thank you for that feedback. If we can go to the next slide, please. A reminder, we're going to have lots of public hearings. We have 3 public hearings that are sponsored by Multnomah County, but I also want to remind us that the approved budget hearing is also a chance for public feedback and community feedback. Also, the Tax Supervising and Conservation Commission hearing on May 15th. The community can come and provide testimony there as well when we adopt the budget, that is. And then in between all of this, you also will be holding regular board work sessions, and there's a chance for public comment at the beginning of all those work sessions. So we're really trying to kind of capture all the avenues for public engagement in this process. And then on top of that, during the budget, the department work sessions, the community budget advisory committees give their report out at the beginning of each of those work sessions as well. So covering all levels, and the hearings are both in person and virtual and geographically dispersed across the county. So if we can go to the next slide, please. Budget deliberation, which is very exciting. So during budget deliberation, I just want to remind the board that you can propose an amendment at any time during any of these work sessions. You can also propose a budget note, or you can ask for a fiscal year 2027 briefing, which theoretically could set up a work plan for the board going forward into 2027, and you can ask for more information. We do our best to provide you answers within the context and the time frame of the budget. If a question is bigger than what we think, we will suggest that maybe it goes onto the briefing schedule for the next fiscal year, and we'll get you the information that we have available. But if it requires a deep dive or a more in-depth analysis, we'll make that suggestion. I also want to note that all board questions that get asked and answered get posted on our website as well, so that if the community is following along at home, we want to make sure that they understand what information you're getting. As I say, I do really ask that you flow all of that through me. It's really hard for me to follow up to questions that I don't know were asked. So this is where I start to get a little bossy during and micromanage the budget process for good reason. But yeah, I do ask that it all gets sent through me. So we appreciate that, or through the chair's office, which they have been, they know to send it to me, and we'll get that taken care of. We will also capture things during the work session as well, and then follow up with you if we maybe think we missed the essence of your question or ask clarifying questions. So if we can go to the next slide, please. Budget adoption components. Everyone's always surprised when we get to budget adoption day and it's like 4 hours long, and it's because it's not just the budget itself or the amendments, but we also have to levy property taxes. Every year I try to forget to levy property taxes, and every year Jeff's like, please levy property taxes. So we'll do that. We'll adopt the budget policies that Eric, the financial and budget policies that Eric's going to talk to you about this week. We adopt our investment policy. We have a fund resolution. We have compensation packages, and then we have the fee schedule as well. So that is just a series of things, and we will talk about all of those things before budget adoption day. So if we can go to the next slide. This is where I'm really going to get into my notes a little bit here. So when we talk to you about the Thank you. When we talk to you about the budget, we start to make like categories or distinctions about the budget. So there's the total budget and the operating budget. In the last few years, we've really tried to, in places where it's really important, is to make this distinction. So the total budget is everything that's in the budget. That is our $3.9 billion budget. This includes all the resources that we know, and then all of how we're going to spend those resources, but it also includes all the accounting mechanisms that we need to use because if I don't, then our CFO will tell me that I have done it wrong. And so we need to make sure that we capture all of our cash transfers, for instance. When we cash transfer, general fund is a big one that we send to our capital projects when we're doing those capital projects. That means we're double counting it, right, in the budget technically. So what we do is we say, here's the total budget, but when you strip out all of the cash transfers, unappropriated balances, that's like our reserves, contingencies, things that we know that aren't spendable or that we're not spending in a fiscal year, that gets you to the operating budget. So when you start to look at the individual departments, most departments' total budget and operating budget are the same thing, because they don't have a lot of these accounting mechanisms. But when you get to the Department of County Assets, or one of the big ones that really started to get highlighted was the County Human Services with the Preschool and Early Learning Division, because they have a pretty significant unappropriated balance for the dedicated savings plan and the spending plan that's our future spending. And so it was really distorting the budget, having that being talked about as available spending, because that's not how we're going to operate that program in any given fiscal year. And so we wanted to start make that distinction. We will do our best to identify when we're using total budget versus operating budget, but it is something that I just want to plant that little seed in your brain as you're thinking about the department's budgets. So if we can go to the next slide, please. As a reminder, we are not the federal government. We cannot run a deficit. There is no credit card spending at the county. So the budget must be balanced, which, we all know as revenues are increasing, you have the opportunity to increase spending on programs, or at least to be able to cover our growth in expenditures. As our revenues are decreasing, then we have to make reductions, or sometimes it's not even that our revenues are decreasing, it's just they're not increasing at a pace fast enough to cover what our growth in expenditures is. And Jeff covers that a lot in the general fund forecast. You're also seeing some of that in our supportive housing services. And so, that's kind of that mixture. So oftentimes people say, well, your general fund increased year over year. And I say, yes, but it only increased by 2%, and our expenditures are growing between 5 and 7%, depending on the category, which automatically means we're in a deficit situation. So I think it's important, because year over year, when you look at the budget, it's going to tell a picture, but without that understanding, it makes it really hard to explain to the community why we're having to make these reductions. So if we can go to the next slide. It's not a budget without numbers. So as we said, the total budget is $3.9 billion. That's not all what we're going to spend on programs, but it is there. We're closer to about $2.9 billion in what we'll actually spend on programs. This is a decrease when we look at all funds. So our capital funds, everything, this is a decrease of $93.2 million. Funds matter in this conversation, so that's not the deficit we're trying to meet. It's just when we look at the year over year difference. That's a 2.3% decrease. This budget funds 5,707 FTE, which unfortunately is a decrease of 166 FTE. We have $21.3 million per the forecast of one-time only general funds, and it fully funds our contingencies and reserves at $24.2 million for the general fund. Sorry.
When you say reserve and contingency,
we have we have a slide later on, but the business income tax reserve, we actually budget in contingency. So it throws that off a little bit. We'll break that out.
That's not our only reserve, right?
Correct. That's for the general fund. And we have a slide that will detail that out in a few minutes. If we can go to the next slide, please. So This is where I need to get back to my notes. So our revenue, all funds, if you look at our revenue, when you combined taxes and beginning working capital, that's like 50% of our revenue. During the pandemic, we saw really our beginning working capital start to increase. We're starting to see that actually come down, but as the general fund beginning working capital is coming down, we're also seeing our preschool for all beginning working capital increase. And so the slices of that we'll go over in a slide in just a moment. One of the places that I want to call out, because we'll go over taxes too, is the service charges. We haven't talked to you about that before when we've talked about the budget. And so that $217 million represents about 6% of our total revenue. And it includes things like the health department, FQHC, Medicaid billing, and the sheriff's patrols for East County. So the health department comprises about 83% of that service charges at $180 million. And then the sheriff's office comprises another 10% at about $21 million. So just, those category names are really driven by Oregon budget law, but like when we break them down, oh, okay, that makes sense. Those are service charge. They're buying services from us, and then we're getting reimbursed for them. So if we can go to the next slide, I wanted to just break down that beginning working capital of $1.1 billion. So you can see here when we start to break that down that half of that is in the preschool for all fund. Then you have the other funds, and only now about a little less than 10% is in the general fund. And then the final one is the supportive housing services. They did their forecast in early February with you all and have been talking about how that beginning working capital, like we built up a lot of funding in the beginning of the measure, and then as we've planned and spent down that and developed our systems, our homeless services programs and systems, now you're seeing that beginning working capital really shrink over time, and that's part of why in the last 2 fiscal years we've had to make significant reductions in our supportive housing services measure funding. So if we can go to the next slide, I'd also like to just break down taxes for a minute and remind us. So, our biggest driver of taxes in Multnomah County are property taxes. But we do have taxes that said, you can see the blue is in the general fund and then the green is other funds. And I was like, Jeff, where do we have property taxes not in the general fund? And he's like, well, we have this little thing called the Oregon Historical Society levy. And I was like, yes, we do. So that's a really good reminder of us. Personal income taxes there is preschool for all. Some of you might say, but don't we charge a personal income tax for the supportive housing services measure? And I would tell you, Metro does. That is correct. Well done, Commissioner. So we just need to remind ourselves that that is a pass-through payment, that those revenues get passed through to us, so that the personal income tax truly is preschool for all. Then you have your business income tax. Motor vehicle rental tax, again, a little bit of that sits outside of the general fund, and this is monies that are in the special excise tax fund that are passed through to the Oregon Convention Center and the Visitor Development Fund. Then you have the transient lodging tax and then a handful of tiny other ones, totaling that $958 million. If we can go to the next slide, please. This is just a shape. We just wanted to show you the trends of how this revenue is happening. And you can see that that beginning working capital really took off and has been a significant portion of the revenue across all of our funds, which is challenging because oftentimes that is one-time only money. And so we really need to be very thoughtful about how we think about using that funding and spending it over time. And then you can see everything else is pretty flat or steady growing, with the exception of some of our intergovernmental revenues, and that would be some of the federal state funds. We had the mid-year rebalance. All of that's going to be reflected in this budget as we think about it year over year. And so just wanted to, again, this is less about individual numbers here, but the shape and the trends of how the revenue's going. So if we can go to the next slide, please. So this is now shifting from the revenues that are supporting the budget, but looking at the expenses or where we're spending the funding. Which slide are we on? I messed up my notes. 15, I went way ahead. Sorry. So as you can see here, personal spending and contractual services make up about, over 70% of our total budget there. Oftentimes, contractual services can be professional services or services for what we think around construction but these are also pass-through payments to our nonprofit providers, which in theory is buying people and people who are delivering services. So a lot of times you can see that those things are growing at a pace that is far higher than, say, like materials and supplies or internal services, which is people too, or debt service, that it is a more slower growing or even a steady payment. And so we'll get back to this in a minute, but when we think about all funds, you're picking up all of the health and human service funds. So the personnel and contracted services are very even in our spending patterns. When we get to the general fund, you'll see that shift, and we'll point that out. So if we can go to the next slide, please. Again, this graph is just to show you the shape, but I think it's really important here to point out that we're seeing that pretty big drop in our contractual services. This is primarily due to homeless services having spent down that beginning working capital, those one-time only funds, and then also seeing their ongoing revenue kind of flatten out and not seeing those same growth trends. And so you can see that the homeless services is decreasing by about $63 million. Contractual services make up over 80% of their budget. So anytime there's a big impact to that department, you're going to see this. There's a little offset here because we're also seeing increases in the preschool for all early learning division. Their contractual services are actually increasing over time, so it's kind of masking this a little bit because as they're getting to kind of their increased seat numbers, so we're getting up to 7,500 seats, you're seeing that spending ramp up in that category as well. The other thing that's in contractual services is the Department of County Assets. They have spending through their facilities that through the library capital bond funds. So, as libraries go up, the spending goes down, which is the right trajectory, and we'll talk about that in a moment, but you're seeing some of those shifts in that spending, those spending patterns. We can go to the next slide, please. Okay, so one of the things we changed this year, I don't know if you remember last year, we had a lot of bubble charts that showed you for the year how things kind of stacked up, but we didn't show you a comparison year over year, and so we really wanted to break this out by our categories, but then show you the, the comparison to the previous fiscal year. And what you're seeing is pretty in line with where our revenue forecasts are. So you're seeing personnel costs are increasing year over year, which is to be expected with COLA and benefits and those types of things. But in order for that to be kind of a year over year to keep pace with the amount of FTE that we have, we would need to see that at a much higher level than 2.3%. So although it shows growth, it really is a reduction in those areas, and we're going to see that when we talk about FTE. We're also seeing that pretty significant drop in our contractual services. Debt service is continuing on pace of our debt schedules, which Eric will talk to you about. We have to budget for that. We have to make those payments. We are obligated to make those payments. Materials and supplies, you're seeing year over year for all funds a decrease of 5.3%. When we get to the general fund, you're going to see an increase there, but I have an explanation for you that will make a lot of sense. And then also, as the chair talked about when she released her budget, internal services made some pretty significant reductions going into the budget process. Those reductions then flow out to all of our funds, and so it reduces the cost of the programs if the internal service costs are reduced. So, that growth is pretty minimal year over year for internal services. That reflects those reductions that they've taken. And then capital is kind of something that is pretty year specific, so we don't expect that to be, the year over year comparison doesn't always make sense for capital.
Christian, just
Yes.
one thing on this. We generally have not been talking about the FTE decreases that happen in these contractual services. I will be interested this year in understanding the impact on staff in the contracted agencies, as well as the number of union jobs that are impacted in our provider agencies.
Yes, thank you, Commissioner. And I talked to all the chiefs of staff a little bit about the challenge with me getting that data. My data is not always the best data for it because it's not made for that, but we will pass that along to the departments, especially the departments that we know have the bulk of those health and human service contracts as they're coming to present during your work session. Thank you. If we can go to the next slide, please. All right, significant operating. I didn't title my slides exactly, and I can't see the page numbers, so I'm like, oh, wait, where are we? So the significant operating funds, this includes capital here, but again, we just wanted to show you the kind of that year-over-year comparison. So you're seeing the general fund, 2% increase in the general fund is, or 0.2% increase is incredibly, signals that we're in deficit spending. The federal state fund, I just want to remind everybody again that we took pretty significant mid-year reductions. Those, because we go adopted to proposed, it's capturing all those mid-year reductions in there. So in the department's division narratives, for the divisions that were specifically implicated from having to take those reductions, we've asked them to explain that and in their significant changes. So some of these actions the board has already taken, right? But now it's just making its way into the actual budget to see that year-over-year difference. Our FQHC fund is pretty flat year-over-year. Preschool for All is growing, but that's also what we're seeing is where the funding is now being allocated out to support the seats and the programming. And so that's the programming dollars, not the total budget that you see there. Supportive housing services, as we all know, is shrinking due to some of the loss of revenue. And then all of our other funds are, for all intents and purposes, pretty flat as we see them year over year. So we can go to the next slide, please. It's just a little slow. So just wanted to show again trends and shapes. And so you can see that for the most part, internal services, materials and supplies, debt service, kind of historically have just been trending at a pretty slow growth rate. And then you see our personnel services and our contracts for when we look at actual spend, that you're seeing that growth. A lot of that is due to the fact that we passed 3 measures in 2020, and so you'll see that start to like ramp up in relationship to those measures. If we can go to the next slide, please. And then I wanted to show you the operating expenses with capital funds and operating funds, because when you look at this slide, if we didn't make that breakout out, county assets looks like the 3rd largest department in the county. They have significant capital funds in there, and the library bond. It all takes work. They're doing work with them, but a lot of times what happens is we budget the total capital project and then it gets spent down over time. So really our 2 largest operating departments, when we think about all funds, all funding sources, are the County Human Services and Health Department. They're over $1.1 billion, and just about 40% of our total budget are captured in those 2 departments. I think it's really important. When we see the general fund, you're going to see that change and how the departments are funded. So if we can go to the next slide, please. Actually, can we go back one, Tasia? I forgot one of my important talking points here. County management and non-D also look really big. And that's because county management has $183 million out of that $258 million is the risk fund. That is where we operate all of our healthcare plans, all of that, and that all gets budgeted in county management, almost all of it in central human resources. So when county management comes to talk, we have the risk fund broken out so that you can see what's being funded by the general fund is really like more operations versus the risk fund. And then also in non-D, my favorite department, I'm not gonna lie, because I do their budget, with lots of help from Aaron Russell, we have all the debt payments here. So there's $119 million of that $241 million is the debt payments. That includes the $36 million for the PERS bond. It includes the $59 million for the library general obligation bond, and it includes $23.5 million for our capital debt retirement fund. So, when you take those pieces out, if we go to the next slide, then you'll see that the picture looks a little bit different when you take capital out, but you can see also how things are funded. So if we can go, I think we can go to the next slide, please. That just gives you a breakout so you can see kind of the different main funding sources that are coming in for each department. They'll also talk to you about this when they bring their department presentations. Next slide, please. So our voter initiatives, just wanted to make sure that we're calling these out specifically. So you can see library capital construction is going down, and I heard our East County Library is looking very cool. I missed a tour of it. I'm very sad about that, so I'm going to have to sneak in there. But I will come on. Thank you for the invite. So yeah, that's exciting. We expect to see that fund decreasing. Preschool for All is increasing for all the reasons that we've talked about. And then our supportive housing services, we're seeing this kind of like we were increasing, and now as the funding is stabilized and we have a more set and robust set of programs that we're funding, you're starting to see where we're having to make adjustments in that funding source. So if we can go to the next slide, please. I just decided this year that we needed to throw in a debt overview slide. Usually Eric will talk to you about this during his presentations, but we just wanted to really make sure that we kind of daylight the good work that our CFO's office does and keeps our debt in line with what we can afford, which is a really important component. So our debt limits get set by the local government borrowing, public borrowing, and county policies. And they basically say that we can issue debt at 5% of the general fund revenues, and you can see we're well under that amount. And it's just a reminder that, we could levy up to $355 million of debt. That would take about $30 million of ongoing general fund revenue to pay that debt. So any debt that we go out and issue, if it does not come with a revenue source, we would need to be able to fund that through the general fund, which would put additional pressure. I'm not saying it's not important, but it's just the trade-offs that I want to make sure that the board, we're just keeping that in the back of our minds as we're thinking about what our trade-offs are going into the future. So if we can go to the next slide, please. So the general fund revenue, we're not going to spend a lot of time talking about this because you get so much time with Jeff, and this is what he talks about. But basically, just wanted to show you that we have about $918.2 million in the general fund. One highlight here is that, nope, I do not have a highlight for this one. I'm just joking. It's what you expected. So we'll break this down in the next slide when we look at year-over-year categories. That's where I have the highlights. So if we can go to the next slide, please. So taxes are on pace of what Jeff was predicting. Beginning working capital is decreasing. But the one thing on this slide that kind of jumps out at you is that our fees, permits, and charges are increasing. This is due primarily to two areas. The Department of County Management has an increase in their recording and clerk fees, about $750,000, and they will talk to you about that when they come. And then the Health Department, the inspections and education fees increased by $500,000, and the tobacco retail licensing increased by $150,000. Normally we would see this more of just growing with a little bit of expenditure growth, but that area kind of jumped out. We'll have the fee schedule tomorrow, and so some of these things will also be daylighted in that presentation. If we can go to the next slide, please. So our general fund operating expenses. Remember when I said when we looked at all funds how contractual services and personnel costs were almost even with each other? When we get to the general fund, primarily we fund a lot of our own internal personnel and FTE through the general fund, and you'll see in a moment that's due because primarily our public safety departments are funded with general fund, and they are really heavily dependent on personnel costs to provide those services. And so that's why you see kind of that shift there. And then you'll just see much smaller amounts in contractual services, internal services, because our health and human service partners often spend state funding, federal funding, SHS funding, preschool for all on those contractual services. If we can go to the next slide, please.
Christian, do we have a breakdown in contractual services that is personnel? And I know there's more than just services but kind of breaking out the personnel cost.
It will depend department by department and how they get that information. So the data that we get is just the total cost of the professional services or contracts.
Okay.
So we don't have that in our system, but individual departments, and I don't know if they have to pull that almost contract by contract.
Okay, thank you.
Which slide are we on again? 27, I can see it's peeking out of the side there. So again, just showing the shape of our trends. You can see that personnel services are really kind of that, and that's driven a lot by, inflation, our COLAs, that also impacts our benefits and those types of things. So you can see that you've seen that kind of increase, or where, personnel costs are growing, and everything else looks just a little bit more flat in their trends related to those areas. So if we can go to the next slide, please.
What was the dip in 23?
Sorry.
Oh, can you go back one real quick?
That might be where we did our PERS, we brought down the PERS bond. One of the years I think we actually have it in our FTE slide.
Okay, yeah, no,
Yeah, we
that's
have it in
fine.
our
Okay.
FTE slide.
Okay.
It's a call out there.
Okay, great.
Yay. We anticipated it. So I'm hoping it's there. If not, we will get back to you on what is driving that dip. So if we can go to the next slide, please. Again, just wanting to show kind of that year over year, and this is where I told you materials and supplies is going to look a little bit different. So personnel costs, again, 2% is not going to be able to cover our entire cost. It means we're in a deficit in that area. Contractual services is decreasing. But when we put this slide together, I was like, what is happening with materials and supplies? And I had a panic attack, and then my team was like, there's a very good explanation for that. And that explanation is that although materials and supplies sounds like pens and pencils and paper, it's not. There's things like pharmaceuticals and computing and software and things that those costs are growing much faster than the rate of inflation. And so two of the main areas that were driving that 7% increase are in corrections health. They have an increase of 1.4 million in pharmaceuticals, and then also in both the sheriff's office and the DA's office, we saw increases in software subscription computing. The DA implemented a new software system, a case management system, 2 years ago, and now that it's implemented, what you're seeing is the subscription to that ongoing software to be able to maintain that and use that system. So I was, had that moment. You have those moments of panic, and then you dig into it, and you're like, oh, that totally makes sense why that would be growing in that area. So just wanted to make sure that you had that information in front of you. I think if you take out those things, year over year, materials and supplies is going down, especially in the general fund. So if we can go to the next slide, please. So here again, before we showed you the departments and their funding with all funds, and Health and Human Services was kind of at the top of that chart. And then you see when we look at where the general fund is invested by department, you can see that the Sheriff's Office at $212 million and 27% is a pretty significant portion of our general fund. Health Department is still clearly a big user of general fund, and it funds very important services that we need, followed by community justice and then county human services. And then we'll show you a slide in a moment that takes all those departments and kind of puts them in what we call service areas, something we've been doing for a while to see how collectively we spend the general fund across those service areas. We also have the one-time only funding in here just because we continue to remind everyone that we have to be very diligent and smart about our investments in one-time only funding, or else we can find ourselves 2 or 3 years down the road where we've built up the use of one-time only funding, and then we're having to make significant reductions that probably our staff, our programs, and the community aren't prepared for because we didn't understand how we were using that one-time only money. And so we will not make decisions, but we will continue to highlight where the risks are in using that type of funding and how we invest it. So if we can go to the next slide, it's going to show the general fund where you can see, so this is since 2019, and you can see that public safety kind of is anywhere between 46% and 50% of our general fund, and it has trended up over the last fiscal year, going from 26 to 27. Health and Human Services has trended down. Some of that is because we have developed other funding sources for that, and so it would make sense that we are able to, when we have scarce general fund dollars, we're able to reinvest them in other areas. And then general government is kind of, edged anywhere between 16% and 20%. Right now, we're at about 19% for general government. So if we can go to the next slide, please. All right, I am going to stop talking and turn it over to Jeff, and he's going to walk us through kind of the reserves and our personnel costs, and I'm really hoping that call out is there for 2023.
I think I remember what it is, but for the record, I'm Jeff Renfro from the Budget Office. I use he, him pronouns. So to start with, we're going to talk about our general fund reserve and contingency. Commissioner, this is what you were asking about earlier. I think that earlier slide was the 24.2, so it was just our BIT reserve and our regular contingency. But in the chair's proposed budget, we have fully funded our reserves at the board policy level, which is 12% of our corporate revenues. As a reminder, corporate revenues are the revenues that the board has full discretion over. In the general fund, there's hundreds of different revenue sources that we put in there, but there's a sort of core of taxes or fees that fund just about all of the discretionary resources that you have available to you. So that's $81.1 million in fiscal year 2027. As another reminder, GFOA best practice recommends 15%. So we, just a few years ago, we're at 10. We're trying to get up to 15 as we have opportunities with one-time only resources available to bump us up. General fund contingency is $24.2 million. That's the regular $2 million of contingency that we just set aside every year. And then our BIT reserve is also at 12% of expected revenues, so that's $22.2 million in fiscal year 27. And as a reminder, we treat that as a reserve, but we budget in contingency, whereas the general fund reserve is budgeted as unappropriated, so the rules around how we would actually use it in the event of a crisis are a little bit different. On the contingency set-asides, there's $500,000 of one-time only funding for severe weather. And then we also have labor set-asides that we've talked about in the past that we use one time only for. We discussed that in March. If we could go to the next slide, please. This slide is a little bit weird because we kind of summarize this stuff all together, but it's actually happening at kind of all different times of the budget process. So we get to the end of it and we look back and we try to kind of put it all in one place. So as Christian said, we have to balance our budget. So as a starting point, in the March 2026 forecast, we had an $11.1 million deficit. If all we did was make cuts to offset that deficit, that would just get us balanced. But through the process of working with the departments and the chair making her decisions, an additional $9.7 million of additional programmatic needs were identified. So then to offset that larger budget gap, the chair accepted $24.2 million of programmatic reductions. And then we also used $3.3 million of ongoing for one-time only capital purposes. That does mean that if it's spent as one-time only in 27, then theoretically in 2028, that's available capacity to potentially fund some of the operating costs associated with the capital investments we're making now. If we could go to the next slide, please. Okay, I'm going to show you a whole bunch of FTE slides, and I'll just reiterate what Christian said. I'm just going to hit a few high points here, and then the departments will come back and talk about all of this in depth. But this is our second consecutive year of reductions in FTE. Even with that, we still remain over 500 FTE above our pre-pandemic levels. If we could go to the next slide, please. Because we're comparing 27 to 26 adopted to proposed on the right side of the graph there. This is incorporating some of those mid-year changes that Christian referenced before in other funds, and then the decline in the general fund is due directly to the structural deficit, which we've talked about at length here. If we could go to the next slide, please. So this compares FTE by department from pre-pandemic to the 27 proposed budget. With the exception of DCJ, the rest of the departments remain above their pre-pandemic level. In the case of DCHS, they are almost 50% above their pre-pandemic level. That's due to the expansion of preschool for all services, as well as some expanded state funding that hit in 22 and 23. If we could go to the next slide. This is that same comparison, but it's looking specifically at 26 to 27. The health department, that big cut incorporates those Care Oregon cuts that we already worked our way through in the fall. Departments will come back and talk about these changes specifically and break them out for you in detail in their briefings. If we could go to the next slide, please. So this compares FTE by represented versus non-represented going back to fiscal year 2019. As you can see, in the last several years, the ratio between rep and non-rep has been fairly stable. Just as a reminder, non-rep and management aren't exactly the same thing. So non-rep includes positions. A lot of HR is non-rep. In the budget office, we're all non-rep, even though we're not all managers. We provided your chiefs of staff yesterday with a more detailed breakdown of what's actually included in non-rep, so you can make a finer analysis on that. If we could go to the next slide, please. This is mostly just here for reference, but this is FTE by labor group. I think the most notable thing here is that Local 88 represents over 60% of our FTE. That's been pretty consistent as long as I've been here at the county. Can we go to the next slide, please? And then this breaks down FTE changes by labor group from fiscal year 2026 adopted to 27 proposed. I'll say these are roughly proportionate to the size of each bargaining unit. So even though Local 88 has by far the most significant reduction, again, they're our biggest bargaining unit. If we could go to the next slide. This is the same breakdown, but it's a comparison from 2019 through 2027. We had to make a few weird little adjustments here because we've added a few bargaining units between now and then. If we could keep moving to the next slide. Okay, this is what we were talking about earlier. So this is the average benefit and insurance costs per FTE. So if we think about what drives these increases, if we take out health insurance, just about everything else that's in benefits and insurance, which is really PERS is the biggest portion of this, are percentages of wages. So in the years where we see the biggest increases in these costs, those correspond to the years where we had the highest inflation, or in the case of 2024, it's when we incorporated all of the bargaining impacts, so there were some pretty significant market adjustments there. Then when we factor in PERS, we have increases associated with our PERS rate going up over time. And then our health insurance, even though I think our year-over-year increase in health insurance costs has been kind of in the 5 to 6% range most recently, which is, I think, by historic standards, is pretty good. When I first got to the county about 10 years ago, we'd just gotten through a period where it was 14% year over year. That still continues to push up our benefits and insurance costs year over year. In fiscal year 2023, the reason for the small increase was we were able to decrease the charge we apply to employees for the PERS bond debt service. And then I think our PERS bond rate was also an extremely small increase in that year. I think we were anticipating high returns on the PERS portfolio. And then I think that our health insurance costs only went up by 2% that year. So we just, a combination of kind of getting lucky on a bunch of things. Great. Thank you, Eric.
It always feels good.
Yeah. So a combination of things that are largely outside of our control just kind of went our way. And then in 2024, that's when you saw the big increase in our wages. If we could go to the next slide, please. So this slide is, I think, is actually really interesting. So this is, It's very simple, but it tells a story. So this is a breakdown of our employees' PERS tier status. So at this point, we only have 171 employees who are Tier 1, only 561 who are Tier 2. The vast majority of our employees are OPSERP or Tier 3. That's 87% of our total. So the bad news about this is that, almost all of the unfunded liability in the PERS system is due to people who had Tier 1 or Tier 2 status who have already retired. So when we're thinking about the problem of the unfunded liability, kind of the problem already exists, the cake has already been baked, is usually what I say, and we're just gonna have to continue to work through that. The good news about this graph is that we've already made the changes necessary to kind of get our PERS costs under control in the long term. It's just gonna take us another like 14 or 15 years to actually enjoy the benefits of the decisions that have already been made. If we could go to the next slide. Okay, we've referenced this a few times, but our one-time only continues to decline from those post-pandemic peaks. In fiscal year 2023, when we were putting this graph together, we realized that when we were talking about one-time only during that period, we kind of we took out the money we needed to fund a per site account, and I don't think we ever actually said publicly that we have $119.8 million of one-time only available. So then as I was more successful at forecasting the BIT, and then as departmental underspending went down, we've seen this decline year after year to something like the more normal level pre-pandemic. Based on the amount we had available in 2027, by board policy, 50% of that is $10.7 million that would need to go towards capital. Sorry, I have to look at my notes for the exact number. The chair's proposed budget allocates $15.1 million of one-time only to capital, so we exceeded the target there. $12.4 million of that is for the Sobering and Crisis Intervention Center. I'll say, so one-time only has declined by 82% from 2023, and it would not surprise me if it continued to go a little bit lower. In my early years at the county, I've been here for over 10 years now, it was not unusual to have, $14 or $15 million as the total one-time only available. And then as budgets continue to get tighter, that's going to continue to squeeze departmental underspending. If we could go to the next slide. We are so close to being done. So in summary, the 2027 proposed budget implements $24.1 million of general fund reductions. Our 5-year forecast anticipates several more years of cuts after this. It's a net reduction of 166.18 FTE, but remains above our pre-pandemic levels. Inflation concerns continue to be central to how we're thinking about future personnel cost drivers. We currently have 5 open labor contracts. 2 of those are getting really close, but even after those are done, we'll still have 3 open labor contracts. And then the regular Local 88 market adjustment that's in the Local 88 contract. And then any changes that we would need to make as a result of state decisions that happen after we go through our process would potentially be incorporated into a fall rebalance. So with that, I'm going to turn it back to Christian to finish us off.
Just really quickly, I just want to remind everyone where some information is. So we keep everything on our website, and we will post everything throughout the budget process on our website. And if we can go to one more slide. So there's our beautiful budget. If we can go to the next slide, please. We want to remind everybody that the dashboards are up. I do want to say on Thursday when I said our web address and that the budget was available, we kind of mini broke Multnomah County's website and everything stopped running. And then by the end of that day, I think we had over 1,200 views on our dashboard, which so it's really exciting. My team is fantastic. They're amazing. I won't call them out by name because they will get very mad. But I think we have already over 3,000 views. As a reminder, with each version of the budget, we take down the previous version of the dashboard because it is very confusing for people if we don't do that. And so we don't want to mislead anybody about the decisions that are being made. But there's some great information in there. Also, because we scaled down the program offer to 1 page, there was information that was on the backside of the old program offers that we knew we wanted to keep, like the legal obligations or the revenue description, significant changes. We're publishing that in the dashboard, just not in the printed document. So if you're like, oh, I really need to find a little bit more information about this program offer, try the Tableau dashboard and see if that, if not, please call us first, but then try the dashboard. So if we can go to the final slide, I believe, has a bunch of links here. I always say the budget director's message has a ton of information in it. It is also our historical record, so when we have to go back, once I had to go back and grab 30 years of budgets for a project that the DA's office was doing, and it was just like this beautiful historical trail of why we made decisions. So it's long, but there's a lot of great information in there. So just gonna plug that really quickly, and we will turn it back over to the board. Thank you for allowing us to come and chat about our favorite topic today.
Thank you all so very much for such a great start and a really good overview to start us off on this budget process. I'm going to open it up to the board for questions. We'll start with Commissioner Singleton.
Thank you, Chair, and thank you all for this work. I know distilling everything that's happening into these slides is a lot. I asked a bunch of my questions during the presentation. I think, I guess just to follow up on the piece around the contractual services, I'll plan to just ask that in each department's presentation about personnel. I know at first this feels like the wrong word, but personnel versus other spending. I am interested in when you talk about FTE and overlay around span of control. I know we had that kind of report and update, but that was pre this budget. And so is there work happening there to bring span of control into our conversation?
Yes, Commissioner. So we asked everybody in their transmittal letters to use the work that had been done on, I think, December 1st by Class Comp. And now we're asking them to take the chair's proposed budget, overlay it with that data set, and bring any updated spans of control. So you'll see that in the department work sessions.
Awesome. Thank you. Sorry, I went through your appendices, so bear with me. I had some back here too.
I'm real envious of this color coding that's happening right here and all the little, so I'm feeling very underprepared.
Jenna is the best. This is so organized. The equity investments, it's slide 77. I think I asked this last year, but it always gets confusing to me because equity shows up in so much of our work, but then we separate out just these FTE. Is this just the staff that have the equity manager or some sort of equity title?
Correct, Commissioner.
Okay.
So for years before you were on the board, we were ramping up this work, and the board was consistently asking how much investment are we making internally? And so we just started asking everybody to provide that information because it would take a long, we were digging through trying to find it all, and so we're just out of consistency, we said the board is interested in this. We can always change that if we want to change the definition or how we think about it. That's kind of a holdover from as we were building up our equity staffing and our internal services.
Thank you. It leaves a picture that we're not spending, I know we're spending a lot more in equity investments than just these staff. So yeah, thank you.
And this slide might even be more like internal equity investment or something like that because it doesn't reflect the external program.
And I think that's it for me on questions. Yep, because the rest are then the central CBAC. So thank you. I know that I know that I don't have the budget amendment form yet. I think you also know that I know some investments that I want to make. I did bring those. I will hand those out as the next person goes. But I will say my intention is absolutely to approve the budget as written. I just want to put it out there on the table where I'll be focusing my investments as we move through this process. So I wanted to clarify that before I hand any of these papers out.
Thank you, Commissioner. We appreciate that clarification.
All right. Thank you. Commissioner Jones-Dixon.
Great. Thank you, Chair. Thank you both for providing the overview. The only question that we have is just in regards to the our priorities that we submitted back in February. We've been combing through a lot of the program offers. We wanted to know if we can just get a written response as to where they might live and if they're reflected in the current in the budget.
Thank you, Commissioner. Yeah, that was brought up yesterday, and I believe your teams are working through Sarah Ryan in the chair's office to get follow-up on that.
Got it. Great. Thank you.
Great.
That's it.
All right, thank you. Commissioner Moyer.
I don't have questions right now.
Okay, great. Commissioner Brim Edwards.
Yes, I want to thank you for the presentation. It was very helpful just to get the overview. I'll have some very specific questions when we get into the department budgets. I appreciate the appendix because it gives a lot of information. Just for the general public, since they were referenced several times, you mentioned that the information was provided in a board staff. I'm wondering if that's in a forum that you can upload it so everybody has all the information, like I say, not just the commission or individuals who are at board staff. If it's in written form, appreciate that. And then one of the questions I had is, this is just more a general, I didn't hear if you said this, what is the rate of inflation you're projecting for this year?
Commissioner, for fiscal year 2027, we're using 3.3%. But because of how we calculate the COLA, the CPI data already exists. So we know that's the COLA that we'll be using for 27.
And just given the war and the volatility that we've seen over the last month, I'm just curious, are you thinking of that in a range? I know you have to pick a point in time, but I'm just curious because, we go through the whole budget process and then we have the fall rebalance and other changes. So I'm just curious how you will handle that potential volatility, just knowing that for everybody who's managing a budget, whether it's buying services or supplies, or from just individuals who work for the county, their rate of inflation and affordability index. I'm curious about how we're going to approach that.
Yeah, so based on our labor contracts and then based on how the contracts with our service providers work, the way that we incorporate inflation is it's always backwards looking. So as we're thinking about the impacts of the war and the price of oil, it would be incorporated into our assumptions for fiscal year 2028. If there are programs that, get partway through the year and their inputs, just in reality as they're buying them are significantly higher than what they were expecting or what was pushed through in the general fund allocations or pushed through in their contract, they could either choose to try to find savings or reallocate internally, or if it was a big enough issue, they could theoretically come to the board and ask for contingency. But in our most recent forecast for 2028, I believe we were assuming 2.75 for our COLA, and based on how things are going, we're going to have to bump that up.
Great, and thank you. And then, so the funds available in contingency, say if they were, because I just think it's probably reasonable to expect that there could be implications just given how the last couple of months have gone. There's $2 million in that contingency.
Yeah, so every year we, as a starting point, we call it regular contingency. It's just $2 million that we set aside as our starting point for the board to have.
Okay, great. Let's see. So one of the questions I have, and maybe this is for the chair, but it's in the ongoing work that we're doing with the city in just we've had a recent session on the city has a certain number, a certain set of sort of funding that they've set aside for, everything from shelters all the way to housing and the services in between. And we also have those resources. And I'm wondering the process by which this budget will be sort of not compared, but looking at like where there's overlap or complementary investments that are being made either in the mayor's budget or the budget that's then amended by the council, and then also their recent reallocation of one-time only money.
Do you want me to take that? So Commissioner Brim Edwards, there's lots of conversations that have been happening for a while now between staff at the city and the county level, and then also at some of the elected levels. But I think the best chance for us to really have that conversation with our city partners is going to be next week at our joint city-county meeting. That's very specifically set forward in the IGA for the mayor to present a high overview of his budget, for me to present a high overview of my budget, to talk a little bit about from the HRAP plans, like where that fits in terms of budget allocations, enabling us to meet certain goals that we have set out in the HRAP, and then have a conversation between our two bodies about some of those investments. So we have some time next Tuesday afternoon over at City Council to start those conversations.
And I'm wondering, what about the recent, like 50+ million of one-time only money that was allocated? Some of those allocations, investments, overlap or, maybe complement the other investments that the county is making.
Yeah, so there are some conversations about that. I think what I've heard from some of the counselors that I've talked to over there is there's a desire to have to not have those allocations produce a duplication of services between the city and the county. So if there are some things that we already, for instance, have administration step for, then potentially it would be easier to have us disperse some of those. That hasn't been discussed for every single one of those items. But those are conversations that we're having now based on the allocations that have been recently made. And I do think that that's something that we can dig into a little bit more next week as well. And I know that we've got some commissioners here who also want to jump in on that.
Thank you, Chair.
I just
wanted to finish and say that the eviction prevention work group, this is an issue that they have highlighted, and so some of the recommendations we'll see out of that group likely next week include bifurcating the eviction prevention system from legal services and rent assistance. So I think this is something that's on a lot of folks' radar, and I've had good conversations with city council folks as well about wanting to take away having duplicative administrative structures.
So what I was going to say is I would hope that we would be having these, be able to have that discussion. I appreciate, Chair, you raising that we have a meeting next week, but just given the very massive cuts that are going to be happening and also reductions in staffing based on the shelter cuts, both from the proposed in the county and the city side, that it would be good to be having those conversations in a public setting, not as side conversations, just so we can see the totality and make some prioritize based on what we now know is sort of the universe of funding. Obviously, we're going to be just making the decisions on behalf of the county, but I would hope that we do that all in one place and in a public setting with the full commissions and council. Thank you. And that's all the questions I have.
Okay. Thank you, Commissioner. Yes, do you have a follow-up?
I just wanted to say what I handed out, because I didn't. I was just like, I'm handing these papers out. So I just handed out to folks a package that is investments for workforce that span a number of departments, as well as some preschool for all investments, and oh my gosh, what was my third one? The eviction prevention, some of the recommendations coming out of that work group. So I wanted to say all of these have been discussed with departments, will continue to be workshopped with departments, as well as the deputy COOs and COO. I just wanted folks to know what was handed out to them, and Commissioner Brim Edwards, it should be in your inbox as well. Thank you, Chair.
Great, thank you. And I just had one question, actually, from the slides, and it's not a question, it was more of an observation. So on slide 43, I really actually like the historical look at the one-time only funding, because since in my time on here, it has felt way different, you know, and I think if you went back even further, we didn't have as much one-time only, because 23 was like right at the height of all the federal ARPA dollars that were coming through the county, but we have seen a sharp decrease. But I just wanted to point out, this is also just general fund dollars. It doesn't include the one-time only SHS dollars that we were also trying to figure out how to program in the best way. So one of the things that I don't think I mentioned last Thursday when I was presenting with my budget was that it was very intentional for me this year to really make sure that we were using one-time only dollars in the best way possible to set us up, knowing that we were having cuts not just this year but in future years, to really truly fund ongoing programs with ongoing dollars. So, and this I think shows exactly why we have to make sure we're doing that. So, all right, thank you very much for this presentation. We're now going to move over to our second topic around the budget today, which is our Central Community Budget Advisory Board members who are going to be here. I'm so glad we have the opportunity to hear from the members from the Central CBAC. I think we have Terry and Sean here today, and Amada, of course. So I want to welcome you up here. So Terry serves as the chair for the Central CBAC. And I'm grateful that we have this opportunity to reflect on the good work that the community has provided us at this stage in our budget process. I know that having your reports was meaningful to me as I was putting my budget together. I also know that the work isn't easy. It's not easy for us up here, and I know it wasn't easy for you and your CBACs. And I really just want to appreciate the time, the substantial time that you have all put into this work. And thank you so much for making our budgeting process more transparent and reflective of community values. So with that, I will turn it over to our Director of the Office of Community Involvement, Amada Perez. Good morning.
Good morning. Thank you. For the record, my name is Amada Perez, Director of the Office of Community Involvement. Thank you so much for an opportunity to offer a very brief update on CBAC improvement efforts, especially alongside of the Central CBAC. I think a lot of the changes in the last two budget cycles have come out of a collaboration between OCI and Central CBAC cohorts. Just reminder, as some context, it was actually in 2024 when the chair really directed our office to prioritize the development and implementation of a countywide improvement process for the Community Budget Advisory Committees, or CBACs. So guided by a work group and initial insights that were generated in 2024 listening sessions with CBAC members and CBAC coordinators, as well as recommendations that came from the Community Involvement Committee, OCI has been working really closely with CBAC coordinators across all of our departments, developing a multifaceted integrated improvement plan. And with board approval, improvements have been made through a series of code changes, some that were identified early on, and some of those changes were identified and presented by last year's Central CBAC cohort. Code changes have really clarified purpose and duties, better defined membership responsibilities, and overall operations. In addition to code changes, this budget cycle, OCI has been able to, and very excited to implement programmatic changes that I want to highlight. We now have a standardized, thank you for the slides. We now have a standardized volunteer application that is a central feature of our new volunteer management system called Better Impact. And OCI has fully transitioned to Better Impact, which enables us to really streamline the CBAC application process, produce demographic data, better track membership, intake forms like conflicts of interest, participation, and retention. So since last summer, OCI now submits demographic data with each cycle of CBAC appointments, and these are really aimed at both illuminating the identities and experiences that our volunteer members bring, but also to support OCI in doing more targeted and strategic outreach and recruitment efforts. But all of this is really in service to cultivating diverse teams that reflect our communities and also communities most impacted by county services. So I will say, of course, that demographic data alone fails to show the full complexity of each CBAC or their members' background, relationships, and experiences. So OCI's strategy to improve recruitment and retention of diverse cohorts is to couple quantitative data, like demographic snapshots, with qualitative data, like narratives and stories, allowing a more intersectional approach and a more intersectional assessment. And I think this is going to be really important because we can see more of an investment in developing demographic snapshots now outlined in the strategic plan. So I think this coupling of qualitative and quantitative information is going to be really important. OCI has been an advocate for better impact to the county, and you all probably know that past systems for volunteer management has been decentralized and has contributed to inefficient and inconsistent tracking and reporting. It is our hope that the integration of a centralized volunteer management system at the county, also included in the strategic plan, will have a significant positive change not only to CBACs, but also to volunteerism and civic participation countywide. Good.
It's like poetry.
Yeah, good. This year, we are really happy to have launched a new CBAC policy guide, and this offers 12 pages of detailed guidance on programmatic matters, really picking up where the code leaves off to provide clarity on CBAC procedures, standards, and practices. In addition, this budget cycle, OCI piloted year-round outreach and recruitment, including 2 rounds of appointments in October last year, January of this year, resulting in the selection of 38 new CBAC members. And for the first time in years, all departmental CBACs have been in membership compliance throughout this budget cycle. While 2 rounds of appointments helped extend CBAC recruitment efforts, we did receive and have received lots of feedback from both CBAC members and CBAC coordinators that appointments and onboarding of new members in the middle of the CBAC budget cycle was disruptive, destabilizing, and generally not ideal. So changes to new member orientation and onboarding, however, were very well received by 38 new members joining this cycle. Moving from an optional 2-hour virtual orientation, which was compiled of 4 back-to-back presentations from OCI, Budget Office, ODE, and the Attorney's Office, we now require new members to participate in 3 2-hour sessions, including 1 in-person session. Educational content is broken up and broken down into more accessible, digestible sessions with added opportunities to build community across departmental CBACs. Using participant satisfaction surveys, educational changes received great responses. In a Likert scale that we used after orientations and onboardings, over 74% of new members reported feeling very welcomed, a significant increase in their understanding of county services and programs, a positive learning experience, and a deep appreciation for an opportunity to connect and learn with other people in a room. And then finally, we've instituted feedback loop letters as a standard practice. So we heard loud and clear from CBAC members over the years a very high level of frustration with a lack of awareness on the impact of their collective input. So this inspired the practice of feedback loop letters, and now departmental CBACs actually get a reply letter. A letter from OCI at the beginning of the year responding to participant experiences and programmatic issues that were raised both in surveys but also in CBAC letters themselves, and an individualized letter from the chair to each departmental CBAC that reports on the outcome of recommendations. Lessons learned from this pilot and other newly introduced practices will continue to be reviewed and evaluated at the end of this budget cycle to inform and strengthen our approaches in the next budget cycle. In addition to ongoing general improvements in the areas that I've outlined next budget cycle, you can expect to see a new standardized template for CBAC letters, a refined process and cadence for CBAC outreach. We want to maintain year-round recruitment, likely with the continued really big push in the summer as an ideal season to appoint new community members, coupled with additional appointments through the year as needed for vacancies and compliance. And then finally, added educational support for CBAC members. Again, guided by feedback that we get received on surveys this year, OCI will work closely with CBAC coordinators across departments to continue to deepen the ways to educate and empower community members in their role to both understand and engage in the budget process. So a really big thank you to the board to support this work, and at this time I wanted to introduce two members of the Central CBAC. We can go to the next slide, who will be presenting their collective recommendations today, Terry and Sean.
Good morning.
Good morning, and thank you, Amada, and thank you, board, for having us here today. We can go to the next slide. For the record, my name is Sean Pingley, he, him, from District 2. Hello, neighbor. Before we dive into our recommendations that were covered in our letter, I want to talk a little bit about who we are on the Central CBAC, as well as our process that we sought out to cover for this cycle. The Central CBAC, as mentioned, consists of members that are representative of each of their respective departmental CBACs. They are appointed to the Central CBAC. Under county code, we are charged with providing feedback that may cross departmental lines. And we understand this charge to include both cross-departmental feedback as well as feedback on improvements to the CBAC process that all of the departmental CBACs follow, including Central CBAC. This charge also guided our main process. We established in January of this year, and starting in January, we dug into the past 3 years of transmittal letters, as well as the recommendations made by each of the CBACs this year, and conducted a thematic analysis across those 3 years, but also all of the recommendation letters from the other CBACs, which then helped develop our findings and recommendations that Terry will go over in a little bit. We can go to the next slide. In that analysis of the themes that we saw across all of the recommendations from the departmental CBACs, we saw a number of key themes, as well as common values that were expressed in all of the letters. And I think they're common to what we heard from Amada earlier and in the short time the presenters before. Those pop up as well in the budget letters. These are equity, resilience and prevention, transparency, and cross-departmental collaboration. The themes that we saw resound across all of the recommendations from the departmental CBACs include this larger looming structural budget problem that we're all aware of, repeated budget constraints significantly reducing service capacity as demand grows, particularly for the most vulnerable residents in the county. Cross-departmental prioritization with the planned centralization coming up in this next year that presents some great opportunities for making the budget process more efficient and transparent, removing some of those silos that really affect efficiency and how each of the departments work together. And then some major workforce challenges, including recruitment, retention, and safety are affecting the services that are provided, again, to county residents across all departments. Go to the next slide, and I'm going to pass it over to Terry.
First, let me just say thanks to Amada, who was an enormous help to us, getting us organized, staying focused, and getting the work done. This year was an amazing improvement, and she deserves an enormous amount of credit for that work. Anyway, had to get that out first. So I'm Terry Harris, I'm the chair this year. So here's some feedback. As Sean points out, we looked at all of the departmental letters, and we looked at all of the transmittal letters, and picked out the themes, and then came up with some both findings and recommendations, and mostly just things to think about, which I'm sure you do, but I wanted to just emphasize that we figured that out ourselves too, as representatives of the public who have an inside track to listen to department heads and division heads. We heard it, and want to elevate it here for you today. So the first thing we have here is multi-year planning. Year after year after year of cuts ends up into an exponential diminishment of the services that we can provide, right? If we know that we're getting year after year after year cuts, it might be best to look a little bit over the horizon. So a department head or a division head that says, we're going to get 3 years of cuts might make a different decision than making 3 different smaller cuts 3 years in a row. So having a little bit of visibility over the horizon, I think, would be helpful, and developing multi-year strategies, not multi-year budgets, but strategies for managing that. Metrics and accountability. Again, the strategic plan has some of those in there, and I know it's new, and I know it's going to evolve, and it's a good start. But I think in looking at budgeting with the strategic plan, it's going to need some more specificity and some more focus to be useful. We need to be looking at outcomes and not just measuring things to just be measuring them. Again, that's going to be multi-years, but as you talk to departments and talk about their budgeting, and when they raise the strategic plan, do they have the measurements appropriate to making these budget decisions? And I think in terms of budgeting, those metrics need to be revisited every year, but in advance of the budget. So it should be a precursor to the budgeting. Like, how are we doing? Where are we going? And that needs to probably happen in the fall, before CBACs are really organized. On equity, I think we found that equity comes through in the program offers. It comes through in the transmittal letters. But I think it needs to be more consistent and specific. I think we've been doing this long enough that we can be a little bit more advanced in our thinking about equity and acknowledge our current understanding of our equity lens. And our discussion based on the departmental letters and their approaches and the program offers, equity really comes in 3 flavors in the budget. It's equity inclusion in the workforce, it's equitable access to services and spaces, and it's extending equity into our processes, like contracting or what we do and how we do it. That's it. That's what our equity lens is. If we can get that far and now get the metrics in these categories, we will be that much further in delivering equity throughout the county. And then finally, on this budget feedback from CBAC, we are aware that there's a planned centralization of services looking out next year. We know that's going to be complicated, but it's going to be great opportunity for savings, efficiency, and improvement of systems. But I think it's going to be more complicated than we might think. And it will be difficult for CBACs to sort this out as FTEs move from department, budget lines go up and down, and making year-over-year comparisons a lot more difficult. So we would just sort of urge careful implementation and an emphasis on transparency as that happens. Okay, so that was it. That was our budget feedback. Let me go a little bit into the next slide on the CBACs itself. I'm going to skip down to that last one there. We sort of see this now as taking from Amada's work and our first year, that the central CBAC should be a body that emphasizes continuous improvement in the CBAC system. I think that's a role that the central CBAC needs to do. We are all sort of in agreement on that. And that needs to be an emphasis, and I hope an understanding from the board and the departments that's going to take some work. And the work is up in the upper parts here. Earlier transparency. It would be so much better for the CBACs and be able to give you better advice if we had a better idea earlier as to what the essential trade-offs are, and an earlier understanding of what the problems are in the budget. We understand that state law says you can't talk about the budget and you can't talk about the budget numbers until a certain date. And we understand that, but I don't think it's a big secret as to where these budget numbers are headed and what the difficult decisions need to be made. And so to the extent that greater transparency earlier with the CBACs, I think you get better advice. Relatedly to the metrics discussion, I think the CBACs might be better with a standard year-round operation cycle. At the moment, we all come in, not all CBACs, but a lot of the CBACs come in the fall. We ramp up with learning curves and briefings, and then next thing you know, you got to write a letter to the chair about the departmental budget. It is really difficult to do. If we had more runway up to that process for the briefings, for understanding the metrics, I think you'd get better advice. So that it's something to think about, and we've had some good discussions about that. Likewise with standardization. That is in process, we know, but if we don't have to reorganize ourselves every year with a new CBAC and a new membership and a completely new system that everybody has to learn in January, we'd be better off. And I think we're on the path to doing that. So those are the CBAC improvements that we discussed and hope we get to discuss in future years. And I think that's it. Next slide is yes, that's it.
Well, thank you so very much for this presentation. I think some of your suggestions are right on and are some things we're doing, but some I hadn't heard before, and I think I'm really interested in them. So thank you for being so thoughtful and for doing all this work. We'll go to the board for any questions or any comments. We do have one other briefing or session after this, which is on equity and budgeting overall. So I know that's an important one for you, but I'll turn it over to Commissioner Jones-Dixon if you had any questions or comments.
Just a comment, just a huge thank you for your work on this, and Dr. Perez for your leadership. I know hearing the feedback last year and then hearing the feedback now, sounds like I knew what happened, a complete turnaround, and appreciate the level of intentionality and anything that has to do with the strategic plan specifically and data. We're reading from the same sheet of music, and so thank you again.
Thank you. Commissioner Moyer.
Thank you. 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 Thank
Thank you so much for your volunteerism. I appreciate the feedback around the amount of time. I also am interested in that difference between looking at a one-year budget versus like looking at the reality of the next several years. That's something I'm concerned about because I think it's gonna be worse next year. May that not be true, but it likely is. And to the members who are not here, thank you as well for all that you did. I find this very helpful. And none of this is easy. So having a group of just private individuals give us their insight is really helpful. So thank you so much. I really appreciate that.
Thank you. Commissioner Singleton.
Thank you, Chair. I want to echo the appreciation you all are actually doing 2 CBACs. So just the extra time as well to be in that central space. And what really sticks for me is that inability to really look at across the enterprise where there may be potential impacts that are similar and really understanding how different reductions might impact the same population. I think it's something that we continue to raise and I don't think have the best solution yet for, but just wanted to articulate. I thank you for putting that in there. I think it's something that the COO's office continues to work on as well as the chair. And I think with you and your role in the staff doing this work and looking at how to make some alignments across all the departments, we can get closer to that. And just again, want to appreciate you, the code changes, the staffing, everything has been a lot and it's been a lot to do in 1 year and you have just embraced it with grace and humility. And I really appreciate the work that you've done here and hearing that feedback from the impact it's having on people is really powerful. And I hope that you feel that and take a minute to celebrate your work. Thank you.
Thank you. Commissioner Brim-Edwards.
I'm just really struck by in 2022, I wasn't yet on the commission. I'd been elected, but was not yet, my election hadn't been certified, so I didn't actually get a vote on that budget. But I'm just reflecting on the difference between the engagement that year and the issues that were raised by the CBACs and also the Central Budget Advisory Committee about the process. And so I'm struck by just how far we've traveled, and I really want appreciate both the work of staff and also the members of the Central Budget Advisory Committee. I think, Terry, you summed it up when you said it's just amazing improvement, and I would absolutely agree. I appreciate that there's reply letters. I think one of the reasons why in the past we'd had issues recruiting for some of the community budget advisory committees, some specific ones, because people felt their input wasn't taken or even reviewed. It sort of seemed like an afterthought, not really informing the budget process or the commission. So I like that aspect of it. So just so many improvements that have been made that I think really brings some representative voice of the community into the process at the front end. Thank you also for the very specific recommendations about the multi-years, the metrics and accountability, and equity. And I think I want to shine one particular light on the centralization issue that you raised about how it's going to be complicated. And from my perspective, I think it will be paramount that there be transparency early in the process. And engagement, so we can follow the dollars. If it's not easily crosswalked from, we moved FTE from here centrally for, and also gain some efficiencies, that if it's not apparent, I think will be problematic and make it hard to sustain the centralization. So I really appreciate the call out on that, and any other recommendations you have in that particular area. But I do think transparency and advance engagement so that people can actually see where things are moving is going to be important. Again, thank you for your service. I'm looking forward to hearing from all the individual community budget advisory committees as we move through the budget process.
Great. Thank you, Commissioner. And just again, want to give a huge thank you to you. And Amada, I just want to also, Commissioner Singleton said so many things so well, but for me, having sat in this chair for a long time, the work that has been done with the CBACs and where we are now has been transformational. And it's transformational in the best, most positive way to improve transparency, to improve engagement, to improve the feeling of and not just the feeling, but the reality of this work being just integrated better into the budget cycle. Like I said, the way that I was able to receive the CBAC reports during the time of making budget decisions meant they did have an impact as I was contemplating my decisions, which was phenomenal, and that hasn't always been the case in the past. So I want to thank you specifically, but also thank you as representatives for all of the CBAC work that's been going on, and just appreciate this and appreciate you joining us this morning to help kick off this 6 weeks of really important work. Thank you so much. Thank you. Thank you. We will take that. All right, thank you so much. And now we will move on to our last budget work session segment for today, which is equity and budgeting. So I'd love to invite Laura Shepard, our Chief Diversity and Equity Officer, and some other folks down to the dais. We know, and we've already heard some this morning, how equity is such an integral part of our budgeting process. It's threaded throughout not only the departmental transmitted letters, but also in the executive budget I released last week. And we will continue to center equity in our conversations over the next 7 weeks as the community gives us feedback and the board considers shared priorities to finalize the proposed budget. And to fill us in more on how these values show up in our budgeting process and tools, I would like to turn things over now to Laura. So good morning. Thank you so much for being here.
Good morning, Chair. Good morning, Commissioners, and thank you for inviting us to be here. I'm Laura Shepard. I use she, her, aya pronouns, and I serve as the Chief Diversity and Equity Officer for Multnomah County. And it's my pleasure to talk to you about equity and budgeting. I get excited about a lot of things. This is one of the things that I get really excited about. And so happy to be invited. I, along with my colleague, Dimitri Maddox, are going to talk to you a little bit about how we see the budget equity framework for Multnomah County. It was interesting to hear from the CBAC representatives their observation around equity in the budgeting process, and obviously it's an important thing. A couple of things that I wanted to just start off with is thinking about why do we embed equity in budgeting, and I like to think about it as how we ensure that our financial decisions align with our mission to reduce disparities and improve outcomes. So it means we're not simply distributing resources evenly, we are making intentional data-informed decisions based on need, and this moves beyond numbers to explain how the county serves the community while dismantling pervasive disparities. So we'll talk a little bit about the lens application that we use, which shifts focus to 3 critical areas: process, data, and departmental accountability. Next slide, please. So I like to think of how we embed equity in budgeting by aligning these resources with our mission, our community, and our outcomes. And so the first, right, it acknowledges our reality. It recognizes that different populations face different barriers and require different levels of investment to reach the same outcomes. So it allows us to avoid unintentionally excluding, let's say, people without transport or without internet access or even English proficiency. It centers proactive problem solving. So we use data, I love using data, to find out where the safety net is failing. Where do we redirect resources to bridge those specific gaps? Looks at efficiency. How do we stop spending money on one-size-fits-all programs that don't work for marginalized groups, but also allows us to ensure a better return on investment for our taxpayer dollars? And building off of what our CBAC member said, it contemplates shared power. Right? It shifts the decision-making process to include the voices of those most impacted by the budget, and it allows us to build deeper community trust. So this is how it's about how we make better decisions about public dollars. It ensures our investments lead to more equitable outcomes across communities. And so without an equity lens, right, a budget is just a math problem that funds the status quo. And with an equity lens, the budget becomes a strategic tool that ensures county resources actually reach the people who need them most rather than just the people who have the easiest time accessing them. Next slide, please. So you heard a little bit about, from the CBAC, right, that we use an equity and empowerment lens in our budgeting process. Why do we do this? Well, it's a better way to make decisions about our resources. It allows us to have a structured approach to planning, decision-making, and resource allocation. It helps us center equity and community impact. The lens helps us deconstruct what isn't working, and it helps us rebuild what does. And it operates at individual, institutional, and systemic levels. And in budgeting, it ensures we are not just funding programs, but we're funding outcomes. And the idea is that it moves us swiftly from intention to impact. Next slide, please. So how do we apply this equity and empowerment lens? Well, we use these 5 Ps, which are supported by the budget equity tool. So you see that at the center of that graphic. And if we go around the graphic, we start with people. We think about the people in the process. So who's benefiting, but who is also burdened by the decisions that we make? These are critical questions we have to ask as we develop our budgets. The places, right? Where are resources going geographically? That may look different depending on the region, but we need to ask those questions. The process, who is included in decision-making, right? Who is at the table, who has input, and who gets to be participating in that process? Power, right? Who has influence, who doesn't? And when we think about equity, we sometimes forget that power dynamics play a big role in how we make decisions. People have to be at the table and have to be able to contribute to that conversation. And then purpose, are we aligned with our mission and equity goals? So these questions guide how departments should make and evaluate their budget decisions. It ensures that we're not just asking how much, but we're asking but for whom and with what impact. So these 5 Ps are core to the equity and empowerment lens, and they structure how we assess equity impacts. This budget equity tool is provided to all departments to support them in making their budget decisions. And the tool operationalizes these 5 Ps, right? It helps departments ask the right questions, to use data, and also to document impacts. It creates consistency across departments and strengthens accountability. And the goal with using the tool is that departments aren't starting from scratch, but they're using this shared tool to guide their work that ensures rigor and what we know is important in the budget process, transparency. Next slide, please. So in this slide, when I started thinking about this presentation, what I thought about is, well, what's the difference between embedding equity in budgeting and not? And if we think about a traditional approach to budgeting, which I'm sure we've all been involved in some way, it focuses on equal distribution. You take the money and you say everybody gets equal. It focuses on programs. There's limited engagement as to who's involved with the process and often results in very static decisions. But when we use the equity lens and we apply that approach to our budget process, we target investment based on need. And we acknowledge that that sometimes looks different. We think about outcome-focused versus program-focused. What are the outcomes that we are trying to achieve, and have those budget decisions supported those outcomes? We make community-informed decisions, as we learned from our previous panel. We bring the community in to share with us their thoughts. And then we think about how do we ensure continuous improvement. So we should be thinking about how do our budget decisions improve conditions. So without a lens, right, if you think about that traditional approach, our systems can unintentionally reinforce disparities. But with the lens, we intentionally address the root cause of inequities. And I like to say it's about effectiveness, not just fairness. And oftentimes people emphasize fairness. And what I like to say is fair isn't always equitable. And we sometimes have to think about, are we balancing fairness, or are we balancing equity in our process? Next slide, please. So what does that look like when we take equity and budgeting and we ask departments to embed it? What is the accountability, and how does leadership utilize this tool? Well, they should be translating the budget into real budget decisions and consistently doing that across departments. We support departments through that budget equity tool and utilizing those 5 Ps that should be embedded into their planning process from start to finish, not just adding it at the end. And the idea is that this becomes less of a concept, more of implementation. It's not intended to be a one-time exercise. It's intended to be a discipline. And it calls for meaningful engagement, long-term commitment to address those inequities. What we ask of leadership in this process is to ensure that clarity, consistency, and accountability is part of their process. And part of that means utilizing what we just say is plain language in developing your budget. Ensure that there's clarity of understanding. Equity in budget, in my mind, is how we move from values on paper to how we impact people's lives in our county. And so everything that we've discussed today, right, the equity and empowerment lens, the 5 Ps, our focus on outcomes, comes to life, though, through how departments actually build their budget. So the idea is that this is not just theoretical work. It requires partnership, guidance, and intentional application throughout the process. But these frameworks, right, they don't create change. The actual application does. And what we have created is a framework for our departments to use, but it does require the actual application. So we ask for all departments that our equity managers play a critical role in supporting departments in asking better questions, in using that data more effectively, and to finally align investment with community needs. So we're going to move from framework and talking about the what to the how. So I'm going to turn it over to Dimitri, and he's going to walk us through how this process, how this framework was actually applied in developing the budget in community services.
Good morning, Dimitri.
Good morning. Thank you. Hello, Chair and Board of Commissioners. For the record, my name is Dimitri Maddox, and I serve as the Equity and Inclusion Manager for the Department of Community Services, which means I have the distinct privilege to support animal services, transportation, land use, and elections. Before going any further, I just want to acknowledge, and if you could change the next slide, I just want to acknowledge I represent one equity manager and a group of equity managers that are doing incredible work, and express my gratitude for their willingness to partner together, to resource share, and to collaborate as we seek to deliver equity in the budget process to each of our unique departments. And so much of what you see today is going to be developed from iterations from the work of my colleagues, as well as just reframed towards what is most effective for the Department of Community Services. Next slide, please. Building on the work of ODE and their Equity and Budget Toolkit, each year DCS starts with a manager's workshop in which we emphasize that the budget really is, we remind ourselves that the budget is a reflection of our values, our priorities, our vision, and our story. These 4 principles speak to a collective orientation that the budget process really is stewardship. Stewardship in telling the story of how we intend to put our words into action and detailing the ways in which we serve our community. Next slide, please. This view of stewardship really is connected to being able to name exactly where we sit as representatives of a large organization, government organization, with each distinct division having a history that has contributed to an unjust legacy, such as from historic voter suppression and over-policing of pet owners and communities of color, to restrictive zoning laws in the form of redlining and the disinvestment of infrastructure resources in marginalized communities. Our equity commitment that we have in the Department of Community Services calls us to use our power and momentum to be the place in which all members of our community with the unique, diverse identities and backgrounds that we held find accessible information and resources to ensure our votes count, to support the health, safety, and welfare of pets and their owners, to determine the most fair and responsible ways to use and develop land and preserve nature, and to improve the roads and bridges that support community vitality and preserve the health of the environment. While this highlights a lot of the why, and while this why really supports has supported in previous years the way we tell our story through the budget program offers. This year we sought to continue to develop how we can use our equity and budget process to really improve and inform our decision-making at a further level. And so that's what you are about to see now. Can you go to the next slide, please? Following the initial budget guidance, our director, Margie Bradway, established 5 core priorities for DCS management in considering how we're going to prioritize our budget process. These included core services, which looked at our ability to maintain the core and essential services to the community we serve. Compliance, looking at what impacts a decision would have on the legal or ethical funding or decisions we have to make. credibility, our ability to maintain the promises that we've made to the public, stakeholders, shareholders, auditor, and/or board, especially the decisions that create reform, efficiency, or process improvement. Equity, which I'll come back to in a second, which looks at our ability to address the disparities in the service delivery, as well as carry out our commitment to internal workforce equity initiatives. And then safety, our ability to make sure we're supporting the initiatives in our department that ensure personal safety and the personal safety of employees and the public. A sixth category was added to this, the director's guidance of staff success, which evaluated the impacts to staff morale, well-being, and professional development. And these six came together to develop a framework that we used in DCS as our budget equity tool. This year, we applied this tool to each of our constraint packages, our reductions, as well as our additions, with division leadership scoring the impacts from 0, meaning no impact, to 3, meaning significant direct impact across these 6 categories for each of the reductions and additions added to really guide the ways in which we engage in our discussions on departmental prioritizations and reductions produced. Next slide, please. But it's important to name that in this process, a numerical score can only tell so much of equity, right? And so these scores were also paired with equity statements, the equity statements, and this collectively was ingrained and embedded into our reductions packages that to make it easier for managers to engage in the process, as well as allow us to take a more holistic picture. And in addition, this tool served as part of a bigger strategy for equity across the process of the budget process for us. And so a few key touch points included are highlighted above, which include as I mentioned earlier, the manager workshop that we engaged in, which aligned our managers and supervisors with not only budget process and expectations, but also practical guidance on the budget timeline, as well as how to engage in a process of drafting program offers with plain language and reviewing the 5 Ps that were shared just a minute ago as it relates to our engagement in the budget process. From there, we shared the ODE Equity Toolkit to support the drafting of the program offers, and this stage included partnering with division leadership to understand the budget priorities as well as the emerging challenges as we seek to make these decisions and support the drafting of the program offers and the development of the equity statements. Third, the leadership team, as I walked through in the previous slide, they completed an overview of, they completed the equity analysis using those 6 categories. And I just want to note that as division directors and deputy directors scored each of those 6 categories for each of the what was presented, I was able to provide another set of eyes to support in this scoring, as well as asking any questions for how they went about deciding that. Fourth, as was mentioned earlier, which it was great to see the CBAC represented here, I just wanted to highlight that this is a crucial part, as Laura mentioned as well, of engaging the voices of the community that we serve in the process. And so I just think it's important to name that as a part of this bigger equity strategy as well, as we engaged in the process with our CBAC teams. And finally, the department and division narrative review allows us to explore how we are telling that story and envisioning carrying out the good work that the employees across DCS do every day. And so I just want to note that the pursuit of ensuring equity and in the budget process really doesn't happen by accident, but it takes intentional engagement and collaboration across the organization. And in DCS, I'm grateful for those I get to collaborate with daily and look forward to continuing to partnering together to refine how we can equitably steward our budget decisions.
And so I will end it here, but just also offer that, as you heard from Dimitri, this work happens in each department in different ways, but the goal is that equity and budgeting is embedded in that entire process. It's my belief, though, that we're still on a journey and we should continue to refine and improve that, particularly as it relates to years when there are budget constraints. It is our responsibility to ensure that every dollar is allocated in a way that's equitable. And so this is a process that I am interested in continuing to ensure that we improve and that we fine tune and we think about specifically who's at the table and whose voices do we hear, but most importantly, how are we impacting outcomes with the dollars that we allocate? So I see this as a framework that's good, a framework that continues to need to be refined, and we continue to need to get feedback to understand the outcomes after the budgets are implemented. Is it working in the way that we intend? Are the outcomes achieved in the way that we intended? And we need to continue to refine. And so that's my pledge and my role as the Chief Diversity and Equity Officer, is to continue not only to refine this work, but to also support the work of all of our equity managers in the departments so that we get it right more times than not. And for that, I open up to questions. Thank you.
Thank you so much, Laura, and thank you, Dimitri. I'll see if the board has questions. We'll start with Commissioner Moyer.
This is great. Questions I have is, will equity managers be presenting with their department budgets? I think that happened last year. They will be? Yeah. Great. I'm looking forward to that. I know that we had discussed last year wanting equity managers to be, well, it was a little bit hit or miss, the degree to which equity was part of the budget process. I think that varied by department. I think we gave hopefully a clear directive. This seems to indicate that we have done that. In what ways will we see equity show up other than the, director's message in each department's presentation?
Thank you, Commissioner Moyer, for that question. Yes, the expectation, and it's embedded in the budget equity tool, is that equity managers should be involved in all parts of the budget process, and so that should include the presentation. To your question in terms of how will we see it, as I said, I firmly believe that this is a process that is good and even great, but we need to continue to ensure, and I would go as far as say, one of my favorite words is accountability. I think what you're speaking to is accountability. How can we ensure that what we expected to happen actually happened, and how do we see, the results of that? My expectation, is that as we go through the departmental presentations, that will be embedded in those conversations, And if we need to refine that, then that's work we need to continue to pledge to do. And so that's what I'll be having my ear on as we see the presentations from the departments. I think it's also incumbent upon me as the director of my own department to ensure that that is a part of the process. And so to your point, it is a point that we should continue to monitor, and we should continue to be honest about whether it is working in the ways that it's intended. And if it's not, then I believe we have to be accountable to continue to improve it, because that is our responsibility.
And then I think this is just kind of a larger question that is really difficult when we're looking at successive years of staff reductions and its impact on the gains that have been made in equity. To what degree have you engaged? It could be at all different levels. It could be all the way from the COO to, divisions, in how to preserve the work that's been done in an environment of staff reductions?
No, I appreciate that question. I would love to say that in my role, I'm involved in all of the budget discussions. I am not, but I would say that that's the role of our equity managers, and that's the unique role that they play. And they're uniquely positioned to do that because they are actually embedded in the departments and understand the unique needs and priorities of each department. To your point about staff reductions and the way in which we ensure service priority, I think that that's incumbent upon, and I think Dimitri touched upon it in the process in DCS, is how do you balance those prioritizations against those constraints? And the tool that DCS uses that I have seen in action, which when I saw it, I thought, I'm so glad my budget doesn't require that much level, but they use a really, really analytical tool to understand the impact of all the decisions on all parts of programmatic efforts and system delivery. And look, I would say that these aren't easy decisions to make when we have to make, as you all obviously know, when we have to make those staff cuts and we think about, well, what does that do in terms of outcomes to our community? How do we ensure that our community is continuing to get the service that they need and balance this with staff cuts? I would offer, and I'm sure Dimitri can add to this because he lived through the process. When I talked to DCS Director Margie Bradway, she talked to me about how difficult those decisions were. But I believe what's important in this process is that in his role as equity manager, he was a part of all of those conversations and all of those discussions. Is it a perfect process, and do we get it right every single time? Probably not. The goal in having equity embedded in the budget, though, is to ensure that we get it right more than we don't, and most of the time. And if equity was not embedded in that process, it likely would fall in places where we couldn't ensure that the outcomes are what we need them to be. And equity in budgeting requires us to focus, just as you're saying, on those outcomes. Those are difficult decisions to make when you have to make staff cuts, I'm sure. Again, I would go back to the value of having each equity manager as part of those conversations is to ask those tough questions and to challenge a lot of those decisions. And as those budgets get refined, to keep revisiting. And so what I loved when Dimitri and I talked about his process is that they go through many stages in the process, and he's involved in all of those stages. When you get to that final proposal, the idea is you come back and you still review and determine, did we get it in the best shape we can, right? I do think it's really important, though, to think about after all of this happens, after the budget passes and after the allocations are made, are we still testing to see if the decisions that we made ensured the outcomes that we predicted? And I think that's incumbent, and we're all accountable to that. We have to actually ensure, did it happen the way that we expected? And I think that's the accountability piece, that we have to ensure that those conversations continue to happen.
Thank you.
I think that fits into the strategic plan.
Oh, my God. Oh, strategic plan? We need to ring a bell every time. Commissioner Singleton.
Oh, my Lord, folks are getting punchy. Okay, thank you. And thank you for walking us through what is a really good example of how this should work in departments. I think to Commissioner Moyer's point, we'll kind of see how that, how it is embedded in each department as the presentations come forward. Laura, honestly, almost everything that comes out of your mouth is a perfect example of why you were my top choice for this position. It's so much for me about connecting that data piece to it as well, and also us saying unapologetically, we will continue to prioritize equity in our work here at the county is so critical, particularly under this current regime. I do think we struggle a little bit on the data side in understanding the demographics of people served and who is most impacted. It's not measured everywhere. I think Sam is probably sick of me talking about this data need that we have to actually understand the impact of our programs. I think we also don't always do a great job of having client or consumer feedback outside of CBACs, which don't always necessarily represent service users, right? And so there's some components that I would love for us to continue to improve on. That said, this feels like a great step forward in where I thought we were last year in kind of folding this in and really understanding how equity is showing up in our budgets and in prioritization in these reduction scenarios. One thing around the workforce I think that maybe we didn't articulate in this prior conversation is the impact of, for us generally, being last in means first out. And so I'll be interested in the demographics of staff before and after this budget and starting to understand how much of an impact reductions are having on staff of color, our LGBTQIA2S plus staff, just really understanding if the ground that we might be losing and having the ability to have the most diverse workforce that we can. And then lastly, I will say, I had a ton of questions for departments. I will have them again this year about equity, so understanding what the process is. But then again, coming back to which communities are most impacted by the reductions and how do we intend to serve them in other programs if that's the need. So again, thank you. Just appreciate you and the work and how you're showing up, and thank you so much, Dimitri.
Thank you so much. And Commissioner Jones-Dixon.
Yeah, just to build up, this is just equity in practice, so thank you so much for articulating pretty much what I was going to ask. A lot of my questions have been centered over this last year as far as like how the work that we're doing here at the county, how are the resources coming out to the district, District 4 specifically. We know that the health outcomes, just the disparities that are there, and then how does our budget reflect, like how are we addressing those things? One of the things that I asked our the Spark team is just, can we get more specific? And you talked about that at high level as far as equity. So over the next 6 weeks, as I mentioned, everything that you mentioned, that's the lens, and those are the questions that I'll be asking. So thank you again for putting words to it.
I believe that Commissioner Brim Edwards had to sign off. Is she off? Asia?
She left.
She did, yeah, she had to sign off. So I just want to thank both of you so much for this presentation, for helping kick off this budget process in such a, by centering us really deeply in our equity values, but also the equity work and process that is so integral to the decisions that we have to make around this budget. And it's great to hear during this time about what the process looks like in different departments. And so it was great to really hear about DCS. I was just thinking like, the analytical nature of yours, but just how we can also like use the best practices throughout departments so that we have more consistency and you're really sharing those best practices throughout department as we engage in this type of work. So thank you both so very much and look forward to hearing more from equity managers as we go throughout this budget cycle. Thank you. That concludes today's budget work session. Our next meeting will be tomorrow, budget work session number 2 at 9:30 a.m. There being no further business, we are adjourned.